Well, good morning, and can I welcome everyone to the 30th meeting of the Public Audit Committee in 2025. Agenda item 1 is for members of the committee to consider whether or not to take agenda items 4, 5, 6, 7 and 8 this morning in private. Are we all agreed? We are agreed. Thank you. And agenda item 2 is further consideration of the Auditor General for Scotland report on adult disability payment. So I'm very pleased to welcome along to the committee this morning Miriam Craven, who is the Director General of Communities in the Scottish Government. Also Stephen Kerr, who's the Director of Social Security in the Scottish Government, and Kevin Stevens, who's the Head of Strategic and Programme Finance, Social Security in the Scottish Government. We're also very pleased to welcome this morning from Social Security Scotland David Wallace, who is the Chief Executive. Good morning. And alongside Mr Wallace is Helen Fogarty, who's the Head of Performance Analysis and Strategy at Social Security Scotland. Good morning. We've got some questions to put to you, but before we get to those questions, Miriam Craven, could I ask you to make a short opening statement?
Thank you very much, Convener. Thank you for the opportunity to give evidence today. This is my first time appearing as Director General Communities and as Accountable Officer for Social Security, although I have worked in and around social security for the last number of years. I would like to introduce, as you have already said, Convener, my colleagues who are here with me today. From the Scottish Government, I have Stephen Kerr, Social Security Director and Senior Responsible Officer for Social Security Programme. Kevin Stevens, Head of Strategic Finance and Social Security Directorate. And from Social Security, as you've said, David Wallace, Chief Exec and Accountable Officer, is joined as well by Helen Fogarty as the agency's Head of Performance Analysis and Strategy. Thank you for allowing us to appear together in this one session, as we think that will really aid your ability to be able to see the evidence together from officials in the round. Let me start, Convener, by saying just how proud I am of our achievements on adult disability payment and the hard work this has taken by civil service colleagues across the Scottish and UK governments, our suppliers and our partners. And I am pleased to see those achievements recognised by Audit Scotland and our commitment to continuously improve our system as we move forward. Adult disability payment is, as you know, the largest benefit in terms of expenditure that we have delivered so far under the Social Security Programme. A programme that has now seen us establish 17 different benefits since the passing of the 2018 Social Security Act. Adult disability payment is now supporting more than 500,000 people in Scotland and covers the costs of basic, everyday living tasks for people, such as cleaning, washing, cooking, preparing food, getting around, planning journeys and normal social interactions, be they at work, at home or in communities. Tasks, of course, which many of us take for granted. Adult disability payment is there to help disabled people live independent lives and in accordance with the legislation which Parliament has approved. Our approach is deliberately designed to ensure as many disabled people as possible get the help that they are entitled to. With that in mind, I was pleased to hear the Auditor General positive endorsement at this committee last month, where he said, "We assess this has been a successful project. The adult disability payment has been implemented in Scotland. 500,000 people are now in receipt of benefit and people are largely satisfied." I also note in his report he recognises good early progress in implementing the delivery of adult disability payment and the governance arrangements in place are well developed. In some ways, I'm sure we'll discuss this today, but adult disability payment is still a relatively new benefit, launched only 3 years ago, with the transfer of cases only completing this year. In this regard, it's worth remembering that nothing of this scale and complexity has ever been attempted before, making sure clients are moved off the Department of Work and Pensions systems onto those operated by Social Security Scotland. I welcome Audit Scotland's highlighting the considerable work that has been done in this area and to ensure a seamless transition from personal independence payment to adult disability payment for over 300,000 Scots. The report of the Auditor General comes at a good point as we begin the next phase of our work on social security. If the first 10 years were all about the safe and secure transfer of powers, I suspect the next 10 years will be about the development of Scotland's devolved benefit system. The next 10 years will also be about the outcomes being achieved by the investment which Parliament has voted for and the role which adult disability payment plays in supporting people with the overall approach to meeting their needs. The successful rollout of adult disability payment, a benefit intentionally co-designed with the disabled people it's supporting, does demonstrate, I think, that the Scottish approach to disability benefits is working well and in line with Ministers' commitments to the principles of dignity, fairness and respect. Principles which 9 out of 10 people who responded to our surveys say they recognise. We welcome your questions today and we thank you again for the opportunity to discuss the Auditor General's report.
Thank you very much indeed. Can I ask you at the very outset if you accept the findings and recommendations of the Audit Scotland report?
Thank you, Convener, for the question. What I would say is we recognise the report. We
all recognise it, but do you accept the recommendations and findings?
We have a number of reports going on at the moment, so we have also the Adele.
Sorry, I'm asking about this report here, which we're discussing this morning. Do you accept the recommendations and findings of this report?
What we're doing is we have taken the report, we are working through it, looking at the recommendations, and we are impact assessing that in line with the other reports that we've received, and then we will work to decide what the priorities are for the next phase of social security in line with these recommendations and other recommendations.
Okay. I mean, so you mentioned in your opening statement that you are pleased with the key messages in the report.
Yes.
And it talks in very positive terms about good early progress.
Yes.
That the transfer from PIP to adult disability payment is on track.
Yes.
Is generally quite positive. But it does also, and we'll get to this, other members of the committee will ask questions about this, it does also say that there is not yet a detailed strategy of how you'll manage the overall budget, especially when there is a growing gap between the DWP and Social Security Scotland's bill. And it says that performance information is limited. I mean, do you accept those criticisms as well as that praise?
I think we welcome the report, as I said, and as the Auditor General has said, there has been a huge success for this project in terms of how we have delivered the social security system here in Scotland and developed Social Security Scotland as part of that. In terms of when we look at funding, the social security system is fully funded within the Scottish Government budget. And when you look at the Auditor General's report, he does also say that when he talks about funding, he is also taking into account the statement that was made by UK Government earlier this year, which actually they have reversed any plans that they had within their changes to their disability payment. And they have announced the Thames Review. So for us within Scotland, as I say, we are fully funded in line with ministerial priorities and the social security system is fully funded in those budgets every year. In terms of performance, we can get into that as well, and also my colleagues are very happy to come in and talk about how we work on that forecasting of that spend.
Yeah, and to say other members of the committee will come in with questions on performance and the finances of the adult disability payment system. Last week we were able to take some evidence from Adele Harris, who of course chaired the independent review into adult disability payment. Do you have any initial reaction to the report that she produced earlier this year? Yeah,
we worked very closely with Adele Harris as that report was developed. Adele did a very comprehensive report and spoke with a lot of stakeholders and people who were in receipt of adult disability. She also spent some time in Social Security Scotland with staff and learning about how they actually process an application and looking at it. So we really welcome how comprehensive that was. Also, as you know, there's been an extensive number of recommendations within Adele's report, and the Minister's Cabinet Secretary is looking and reviewing that and giving it the due time and course that it needs to be impact assessed to understand the priorities of changes within there and also the financial impact of them.
Okay. I mean, do you we were told that the expected timeline is that there will be a formal government response by February, as the kind of 6 months since the publication date of the report. Is that your expectation, that that's when we will get the government's response, or will we get it before that, possibly?
No, the expectation is that we will. The response will come from Scottish ministers by the 1st of February, and as I said, that is to give the due diligence to allow the time to be able to really look into that report and respond correctly. Yeah.
So when you publish the government response to the report, you expect there to be some kind of evaluation of the recommendations, the costs associated with them, and so on?
I think you saw within Adele's report as well that Adele Harris has looked at those recommendations and thought about how they would also look to implement. We will be looking at that response, and the Cabinet Secretary will decide how she wants to respond to that report, detailing her response to the recommendations and the plans.
Okay, just really one final question from me for now, and that is, if you go to the report, I was very interested in Exhibit 1, which sets out the 8 principles, and they are ones which I don't need to rehearse now, but principle number 8 is the Scottish social security system is to be efficient and deliver value for money. Do all these principles have equal weighting, or is that a prevailing principle?
So the principles within the Act were developed as part of the process of looking at social security to be delivered here in Scotland. And as you will remember, that was done at the time working with experience panels, who were people with lived experience from across Scotland, who set their expectations of what they were looking for from the Scottish Government. And then these principles were enshrined within the Act and agreed across party implementation. They were not prioritised in terms of the 1 to 8 scoring. These are all in as key principles that need to be delivered as part of our delivery of the social security system.
And so what do you understand value for money to mean?
In terms of value for money, for me, Convener, this is about how we make sure that we deliver in line with the Act and these principles. It's really important that we make sure that people who are eligible and entitled to their social security funding, and for this occasion adult disability payment, get what they are entitled to. So that for us is about making proper, efficient, correct decisions for our clients. It is also, which David will be welcome to come in and cover as well, about running an efficient organisation which is delivering that social security benefit system here within Scotland. Okay.
Again, last week Adele Harris said that her understanding of value for money was not just through running a very efficient system, but also the value that something brings to society. Is that your perspective as well?
Yes, and I'll bring in Stephen as well. So for us, the adult disability payment is about enabling disabled people to be able to get the right money that they're entitled to and to be able to live the lives that they need as part of that funding. But I will bring in Stephen to add.
Sure. Thank you, Convener. It's just to note the work of our distinguished Chief Social Policy Advisor, Linda Bald, who published a very interesting report last year talking about the achievements of the adult disability payment and outcomes that are much wider, such as reducing child poverty, obviously positive impacts on material deprivation and improving health and well-being. And I think that's a really key point, that the investment in social security can lead to reduced demand for other public services such as healthcare, and it can also lead to improved productivity by allowing people who have disabilities to enter into sustainable, well-paid jobs as well.
And Convener, if it's okay, can we bring in Helen as well to talk about the public value?
Yes, sure.
Great, thank you very much.
Right.
So I think you were asking about kind of value for money essentially and how that's created, and I think you're absolutely right to identify Ms. Adele Harris's point. So essentially, if you were looking at the evidence of the public value that's been created through the devolved social security system, you will know that we do a lot of work with our clients. So that's one of our starting points as well, is to ask them about what is the value that they experience by the service delivery to Social Security Scotland. So we have a number of indicators that would suggest that we are creating public value in that way. So, for example, adult disability payment clients responding to the client satisfaction survey that we ran in 23-24 indicated when they were asked about what the impact of the payments, the benefit payments from Social Security Scotland have been on their lives and finances. And the average rating given by those who received adult disability payment was 8 out of 5 for the statement it helped me make a difference to my life. 7.9 out of 10 for the statement it helped me to control my finances. 8.1 out of 10 for the statement it helped me to pay for what I need. We also have lots of other indicators about the kind of value that's created by being treated with dignity, fairness and respect as well. And then more broadly, if you were then to look at the cost of the service we deliver as well, you'll also see that Audit Scotland referenced in the actual report itself as well, that operational costs have performed better than the percentage target set and below the DWP benchmark, which is demonstrated, I think, in Exhibit 6. So the last year's annual audit report highlights that the 23-24 operational costs were £4.8 million under budget. And we will continue, obviously, to monitor that as well. So both the public value that we create and our operating costs. And more broadly, we work with Social Security, Scottish Government Community Analysis Division colleagues as part of the evaluation strategy as well. So that's a significant part as well to look at the contribution to the wider outcomes. We're still in relatively early days when it comes to the implementation of the adult disability payment. Case transfer has only completed this summer. So actually gathering that evidence of the much wider outcomes and contributions that may be more evident in the kind of medium to long term are still relatively early days. But that is certainly something that we are very conscious of when we're looking at our evaluation and our evidence gathering when we look at our performance and our value for money.
OK, thank you. I'm now going to invite Colin Beattie to put some questions to you. Colin.
Thank you, Convener. There's been quite a big increase in the take-up of these benefits. I mean, ADP take-up in Scotland's very much higher than the PIP uptake in England and Wales. As of January 2025, 13.6% of Scotland's working age population were receiving ADP, which is a huge proportion, compared to 5.3% receiving PIP elsewhere in the UK. And it's also very much higher than the 8.5% of working age Scots that were receiving PIP in December 2021 prior to the introduction of ADP. Now, obviously this is partly due to a more accessible and supportive application process, but the statement's also made that it reflects demographic trends, rising rates of long-term illness and disability in Scotland. These are not small increases, they're quite significant. Let me ask, first of all, how is Social Security Scotland working to ensure that these decisions are accurate the first time?
Thank you very much for your question. And I will bring in David for Social Security Scotland. But first, what I would say is, in terms of that benefit uptake, and when you see how the number of applications has been increasing, we would have expected that to happen because, as we say, adult disability was introduced 3 years ago, and you start to see that steady increment of applications coming in. And also we have had the case transfer of people over from the UK system to the Scottish system. Also for us, as we were saying with the principles within the Act, this has been about ensuring that benefit uptake is part of the journey for our clients to ensure that if they are eligible for funding, that they know that they can apply for that adult disability application, then we make that as much awareness of that as part of our benefit uptake as we can. I'll hand over now to the agency who can cover some of those stats as well around that difference of uptake. But also, just before I do, when Adele Harris was here as well last week, she was talking about that trend as well at a UK-wide level of seeing that increase within the disability application spaces, both at UK level and for Scotland. And David can also cover for Social Security Scotland that question you asked about the accuracy of decision making.
Thank you, Miriam. Thank you, Mr. Beattie. And just, if it's OK, Convener, just to put on record as well, we really welcome Audit Scotland's report. We've had a good constructive relationship with Audit Scotland since the agency was formed back in 2018, as well as this report and the previous reports that have been done on the performance. We also have a regular cycle, as you would anticipate, of financial auditing with Audit Scotland as well. So, we have a good constructive relationship. Like Miriam, I think we recognise both the positive messages that are in there and the areas that we would want to improve on as well. So I'd just like to put that on record. In terms of, I think the heart of your question, Mr Beattie, is around the quality of decision making. So within the organisation, we have a sort of strategy around about quality control of decisions. So all of those decisions will be checked. There'll be dip sampling of those and to sort of detect patterns or improvements that we want to make around about that decision making. And there's a sort of a continual learning loop to sort of feedback around about anything that's found in that decision making process. So certainly as benefits sort of launch and go in, and again, I'd just draw out the point that I think was made both by Auditor General Adele Harris and indeed Miriam in her opening statement. This is still a relatively new benefit, so we have only really been doing adult disability in its entirety for a sort of 3-year period. And you do see sort of different trends in lots of data as you launch a benefit and it comes into a more steady state. So this is a benefit that we would describe as still coming into that steady state. But the short answer to your question is those decisions will be made, they'll be checked, and then sort of after the event there'll also be a cycle of dip sampling and rechecking that those decisions are valid.
I'd be interested in knowing what sort of analysis has been done to understand the real drivers behind this increased uptake, because it's okay to say there's a rising rate of long-term illness and disability. Why? What's the detail on that?
Shall I bring Helen into that, if that's okay, Mr Beattie? So I think again there is a sort of a steadying of some of those numbers which Helen can sort of describe as well as we go through that. But I would also emphasise, I think, the point that Miriam has made. In the launch of adult disability payment, we would expect the uptake to have increased. Indeed, it would have been odd for us to have launched in the way that we've launched with what's set out in the artefacts of Audit Scotland's report and not seen the uptake have increased. But I'll let Helen come in if I may.
So just on that one point, did you actually project for an increase of a certain percentage when you launched this? You say you anticipated it, therefore, what's behind that calculation?
So colleagues from Scottish Government may want to talk about the preparation in terms of that. If you mean from an operational perspective, I can talk about the sort of the staffing of the organisation and preparations for the launch of the benefit. But I suspect you're talking about the wider.
Yeah. I just want somebody to explain. You've said to me that it was expected there would be an increase, unspecified. I'd like to know what the specification for that increase was and what the basis of that was.
I think what we're talking about here, Mr Beattie, is the legislation that established the social security system, where there are statutory provisions on benefit uptake, and we've produced 2 benefit uptake strategies. Even as far back as 2017, in the financial memorandum accompanying that legislation, we did indicate that a system that was designed to support people and encourage people to apply for disability benefits would likely have a higher caseload of the comparable system in England and Wales. So when we talk about an expectation that the take-up of benefits would be higher, that's what we're referring to.
But did you project how much higher?
So the Fiscal Commission has the responsibility to produce forecasts for benefit expenditure, and we've been working with them over a number of years now to inform their forecasts with the work that we do, the data that we have, and the trends that we see.
So what was that forecast?
The Fiscal Commission publish their forecasts every year to support the Scottish
Government's budget.
You don't know what
the forecast was?
I can tell you the forecast for this year is £3.6 billion for adult disability payment.
Yep. That's not really giving me the answer I wanted. When you were launching this benefit, David Wallace said that there was a calculation that there would be an increase. That must have been budgeted someplace. There must be a figure in there someplace that started this off. What is that figure?
The figure would have been the initial expenditure on personal independence payment, plus an assessment made by the Fiscal Commission of the policy changes that the Scottish Government has introduced to produce the first rounded forecast for adult disability payment. I think when David...
So what was that forecast?
I don't have the figures for the first year of benefit expenditure with me, Mr Beattie, I'm sorry.
So we were projecting for an increase once this benefit was introduced, but we don't know what the increase was.
So we weren't projecting for an increase. We were anticipating through the framework that the Scottish Government established for benefit take-up that more people would be attracted into the system. It's the Scottish Fiscal Commission who then produced the forecasts to account for a rate of increase. If it can be a bit more helpful in terms of some of the other aspects that the Fiscal Commission perhaps take account of. So, for example, in a situation where the cost of living is rising, the Fiscal Commission in their work talk about the eligible population is more likely to apply for a disability benefit. That's a factor that drives an increase in the benefits bill, for example.
I recognise that, but there must have been a budget from which Social Security Scotland was working, and that budget must have taken into account any estimates, any forward projections of increases in uptake in the benefit.
So I might bring
what was that figure?
I might bring Kevin in here, but the way the budget for Social Security works is in a series of block grant adjustments based on the underlying benefit at England and Wales level. For ADP, for adult disability payment, that's personal independence payment. So that's the budget. Then the Scottish Government decides in making budget decisions how much extra investment in social security it wishes to make and allocates those resources from the budget to give you the expenditure on adult disability payment. The forecasts for how the benefit changes over time and the factors that might change the trajectory of the benefit expenditure is the work of the Fiscal Commission.
So as at December 2021, 8.5% of working age Scots were receiving PIP. So that would be your baseline. Any projection would be based against that figure as a percentage above. So there must have been some calculation made on this. And if you don't have that figure, that's fine. We'll move on. We'll find the figure.
What we can bring Helen in on, we won't have that exact figure, but also just to remind you of the journey that happened when we launched adult disability payment. So what we do when we launch that benefit was you start off first in just a number of areas, and then you start to increase the rollout across the country. So you are only receiving applications from particular portions of the country as you do that rollout. You then move to your national rollout, and that national rollout happened in the August. So if you think about where that would be within the financial year as well. So when you start that journey, it's not that you start with the full caseload on that first day, it's how it incrementally builds. But bills, I'll just bring in Helen as well.
Thank you, Miriam. Thank you, Mr. Beattie, for your question. So I think you were essentially asking about two different aspects. One was benefit take-up and your reading of the Audit Scotland's analysis of the proportion of the working age population. And then your second one was about how are we ensuring that decisions are correct. So if you're content, I can give you a bit more information on both of those. So in terms of benefit take-up, actually we don't have a reliable measure of benefit take-up. The Audit Scotland analysis genuinely gives helpful context for us. But benefit take-up would actually be able to tell us definitively what is the proportion of eligible people, people with disabilities, disabled people, who are eligible for ADP, adult disability payment. But at the moment, what their analysis does is it looks at the working age population rather than just disabled people. But it does give us helpful information. So we are looking at providing that further type of analysis. Social Security Scotland, we're working towards providing that type of contextual information to make that much more robust so that you can see that and compare that. However, you're right, we have seen a recent growth in the caseload in Scotland, which was at a higher rate than what we saw for PIP in England and Wales. However, I think what's really important to acknowledge in that context is in the last year, so basically from July 24 to July of this year, the percentage increase in the caseload for PIP in England and Wales and for adult disability payment in Scotland, combined with the remaining, other benefits, legacy benefit, disability benefits in Scotland. So the combined caseload in Scotland and the PIP caseload in England and Wales converged at a similar caseload growth rate of 10%. So what we saw early on was quite significant rapid growth in the caseload of adult disability payment. That in the last year now has actually steadied and is growing at the same level. The reason I mentioned that as well in particular is, which I think was going back to David's point, was we've gone back and looked at the PIP statistics for what happened in the growth of the caseload and award rates around then. So when it comes to the award rates, which I think is your question about decision making, are we making decisions that look right and robust, and how does that compare to the personal independence payment in England and Wales? What we saw at the launch for the first 2 quarters of published data was quite significant changes. So it was 51% approval rate back between April 2013 and July 2014. But then, but even just the quarter before that, that rate had been at 59% award rate. So it was quite unstable as well. And that, I think, goes back to that bit about the benefit is still relatively new, and particularly with the influence of case transfers, it's taking a while to stable out. I would also just say the other thing in terms of the award rates, from the launch of adult disability payment in March 22 to July 25, so that's our most recent published data, a similar authorisation rate is seen in comparison to PIP during the same period. So 46% of adult disability payment was authorised, which was the same, was 45% for PIP in England and Wales. And actually since December, the end of December 23, the adult disability payment award rate has been consistently lower than PIP. So what we're seeing is a higher rate of applications in Scotland. We're seeing an award rate now that is slightly lower than PIP, and the caseload is now starting to settle. So the growth in the caseload is similar in the last year between what we see in Scotland and what we see in England and Wales. So while we don't necessarily have all the information that you might want, we do have some really good indicators about how that's working in relation to the quality of decision making.
But what analysis have you got of the drivers that are increasing this? I mean, we're talking about various things, but at the end of the day, there's no data.
So I would say there's no data. I would say, so for example, I think Stephen and David were right in highlighting that we work incredibly closely with the Scottish Fiscal Commission on, it's an ongoing conversation, and Kevin may want to come in on this as well. So even yesterday we were preparing for discussions with them where we give them access to our management information. So what are we seeing in terms of our operational delivery? So what's happening in terms of the award levels, our campaigns for communications and marketing, any analytical developments at all. So we regularly share this information with the Scottish Fiscal Commission to ensure that their forecasting can be as correct as possible. The role of the Scottish Fiscal Commission is then to take that and do that analysis that gives us forward-looking forecasts. And I think that's probably important to use, to acknowledge the language around forecasts. These are not definitive. These are not. There is no absolute certainty. These are based on the analysis and the information that we have. And as I said, we do share a lot of our analysis about our award rates, our award levels, our caseload management, comparisons with personal independence payment. We do share that with the Scottish Fiscal Commission, and that is their role, where they do that analysis and come up with the forecasts.
So perhaps more a question for the Scottish Government is, how's the Scottish Government responding to the rising demand with this worsening health trend?
I will bring in my colleagues as well, but what I would say is that what we are doing within the adult disability space is we are making sure that we are have a fully funded scheme, like our wider disabilities, that is fully funded within the Scottish Government budget in line with Minister's priorities, and that we work, as Helen was saying, with the Scottish Fiscal Commission around what the rates of forecasts are going to be. And for us as well, it's also looking broader and working that we gather the evidence for clients in terms of looking to make sure that they are giving the correct evidence to get those application forms, but also we look at public health data when we're looking to see what is going on across our Scottish population. But the key priority is about making sure that people who are entitled to adult disability are aware of it and have the application, that they can either apply for that online, in person or on paper. But I shall bring in Stephen, do you want to come in first?
I think Kevin was possibly going to come in here.
Certainly. Good morning, everyone. I think it's important to note that we do work very closely with the Scottish Fiscal Commission, both in terms of Scottish Government analysts and colleagues in the agency as well. There is a continual process during the year whereby information is shared, discussions are had, the understanding is developed and built. I think with any forecast, the further you look out, the wider the cone of uncertainty is, and the closer that the more closely that you're looking at the future, there are a much larger number of variables that will affect the position. Now, the Scottish Fiscal Commission have a good track record of forecasting benefits. Each year, in August, they publish the forecast evaluation report for the year that's just ended. The percentage forecast error is low. The absolute values that they present in their evaluation report are relatively low as well. But again, the further we look out, the more uncertainty there is. And so therefore, working together with them on understanding what those longer-term factors are is key. What's also important to note is that the funding position for the Scottish Government around benefits is complex. We have 3 different organisations forecasting different things at different times of the year. The Office for Budget Responsibility forecast PIP. That forecast for PIP drives the block grant adjustment that we receive for PIP. The Scottish Fiscal Commission, independent to the SG, forecast all the benefits that the forecast for us. So therefore, we have different organisations forecasting different things at different times. The operational and in-year information that Social Security generate and discuss with us and with the Scottish Fiscal Commission is factored into that as well. And I think it's fair to say that the further ahead in future that we look, the wider that cone of uncertainty is. And I think that's an important point to bear in mind. And also, small changes in the direction of the forecasts for the expenditure side of the equation and the funding side of the equation can have quite a considerable effect on the net funding position. So, for example, just to use some round numbers by means of an example, Convener, a 50 million increase in expenditure combined with a 50 million decrease in funding is 100 million difference to the position. Now, we saw this happen in 24-25, and this is set out in the medium-term financial strategy, whereby the 24-25 forecast that the SFC set in December 2023 was 3.226 billion for ADP. The block grant adjustment was 2.927 million, which was a difference of 299 million, call it 300. Okay, so that was the position when the 24-25 budget was set in December 2023. 18 months later, when the Scottish Government published the June 2025 medium-term financial strategy, the expenditure side of the equation from the SFC for ADP was 3120. So that was a reduction, whereas the block grant adjustment had actually gone up to 2.980 billion. So that was a net funding position of 140. So the Scottish Government would be investing 140 million more in ADP than received through the block grant adjustment for PIP. So the difference between the 299 or 300 and 140 was 160 million improvement in the net funding position in the space of 18 months. So again, relatively small changes in the forecasts for both ADP, forecast by the SFC, and PIP, forecast by the OBR, can have quite a considerable impact on the funding position in a relatively short period of time. And that was just for 24-25. And then the further out we look, the wider that cone of uncertainty that I refer to is.
Just one point I'd like to make to you. You're talking about the statistics and the funding and so on, that's fine. But I'm looking here at this upward trend of people that have disabilities and long-term illnesses. Surely you must be linking ADP with some sort of a preventative health programme, project, whatever, because it's all right just putting people onto the system, but how do you reduce that to the benefit of their health?
I'll come in on that, Mr. Beattie, if that's okay, and colleagues can come in as well. I think when you go back to the principles of the Act and where we talk about the fact that the social security system is designed with the people of Scotland on the basis of evidence, it is looking at what people are living with and what health conditions that they have. It also, adult disability is not an income assessed benefit, so people may be working as well as receiving their adult disability payment. So we are looking at it as what the application criteria is in order to make that decision. Also, we looked at this as another principle, which is it is a human right and it is an essential part of our human rights system, and it was built as a social design around how we do this, but wider within the Scottish Government. There is a disability equality plan that was published this year in 2025 in the summer, which was about looking at how government-wide commitments can centre around disabled people's voices in policy making as well. And there is a real acknowledgement of the fact that our disabilities are very broad and varied, and we need to make sure that we are looking at taking those into account in terms of when somebody is applying for their adult disability payment and wider. And our colleagues across public health, our colleagues across government are looking, and our health colleagues as well, around what are the different conditions that people have and how we try to address that. But what we are seeing in our adult disability is that reflection of people who are entitled to apply because they meet the criteria. That if they meet the criteria, they will successfully get an award. If they do not meet the criteria, then we will not make an award to them. But just wondering, sorry, yep.
We are quite short of time now, so rather than going back round the table, I'm going to move things on and invite Graham Simpson to put some questions to you. Graham.
Thanks very much, Convener. Can somebody just help me out here? The application process for this benefit, does it ever involve a face-to-face interview?
Yeah, so, well, I'll just let Social Security Scotland come in. Yeah, go ahead.
So I think you're sort of, is it Exhibit 2, isn't it, that talks about some of the fundamental changes that have been made. I would hesitate at the word interview. What it can do, we have replaced, in the UK system, there was generally a face-to-face medical assessment. That has been removed from the process in Scotland. And I can say a bit about how we therefore get that medical input to decision making, if that's helpful. But it wouldn't be seen as an interview. We would see it as a consultation. And again, I think back to the sort of the questioning that is from Mr. Beattie as well. The role of the organisation is to help people get what they are entitled to. So that consultation would be designed as a sort of the best way in order to get evidence from the individuals, which may or may not then result in a decision. So yes, we do it. I would sort of hesitate at the language around about an interview. We would term that as a consultation, because the language in all of the social security world really matters, and the purpose of that would be to seek evidence from an individual.
Well, whether you call it an interview or a consultation, it's a conversation.
Yeah.
So, what would be the criteria for asking someone to come in?
So it could also be asked by the client. So there may be circumstances where the client feels that they want that consultation. And again, just in terms of face-to-face, as with lots of things that have been reflected in the Auditor General's report, COVID has changed lots of behaviours, one of them being face-to-face. Equally could be through a video consultation, telephone consultation, or any of those. But from a client's perspective, they might wish to see that's the best way of getting their evidence across to the organisation. or it could be that we've been trying to look at evidence, we might be unsure about something, we might feel that we just don't have the sufficient evidence to make a conclusive decision. It does then come back to a really important point, I think it is borne out here, about the changes that we've made to the system. So members will be aware, under the PIP system, the medical assessment was outsourced. Part of the fundamental changes we've made to the system is not to outsource that medical assessment. We've brought that expertise in-house. So my organisation has around about 300 medical practitioners, health and social care practitioners. So all of the decision makers, I think, comes back to Mr Beattie's point about how do we get those decisions right first time. That is a resource that sits in the organisation. So even if a decision maker is unsure, wants a bit of further information, understanding how a condition may be affecting somebody's lifestyle, they can go to their colleagues and have those consultations as well. But in short to your answer, yes, we will do that when either the client or we feel it's the thing that we need to do.
But just under half, I mean, correct me if I'm wrong, if Ms Fogarty, I think you gave a figure earlier that just under half of people who apply get it. Is that correct?
I can double check that for you now.
It was 40-something.
46, I think it was, wasn't it?
Yeah.
I think that's right. Yeah.
Okay.
And I think the important point Helen was also making, that number has changed significantly as the benefit stabilises as well.
So over half of people who apply don't get it. So why are they not getting it? Have you done any analysis of that?
Well, I'll let Helen come in on that as well. One of I think the really important points about that stabilising, and sorry to sort of come back to it, is if you'd been asking us these questions 2 years ago, I suspect you'd be saying, why are we making far more positive decisions than at a UK level? What has happened probably over the last 18 months is a period where our percentage, our ratio of decision making is broadly in line with the UK system now. So that why are half not getting it applies equally to the existing UK system.
Asking about the UK system, I'm asking about why more than half of people who apply for ADP don't get it. Is it because they've applied in good faith, they've just got things wrong, or are there some who have not applied in good faith and they're chancing their arm, if I can put it that way?
So I'll let Helen come in on that, but there'll be a sense, a combination of all of those things as well. I think it's also, just before Helen comes in on that, that would be our first decisions. So again, there is a process within the organisation that if a client is unhappy with that decision, they can ask us to make a new decision on that. So that percentage would be around about that first decision making. And Helen might say a bit more on this, but frequently what we then find out is that further information might be provided by the client that helps us make a different decision at the redetermination stage as well.
Shall I come in? Yeah. Yep. So, really, really important question to try and understand what is going on with those figures. So, a proportion of the applications will not be followed up with a Part 2 application. So, the Part 2 is, so your Part 1 is where you kind of do your identification and verification application, and then your Part 2 is when you give us information about your disability or your health condition. So sometimes a Part 2 will not be submitted within the timescale. The next kind of assessment could be around your actual eligibility, i.e. do you live in Scotland? So sometimes there is confusion. So we do sometimes get applications from out with the jurisdiction. So that would mean that there will be another proportion that will fall out within the application caseload. And then as David is saying, then you start going through, if the Part 2 has been assessed, you live in Scotland, you've passed your identification and your verification, etc., then you start going into that process of decision making. So have you provided evidence? Have we been able to gather evidence on your behalf from a range of different sources? And then the decision is made on the back of that. I also think it is quite important to acknowledge as well that we are still in the stage of developing quite a bit of our data infrastructure and our analysis. So we would love to have more information around the reasons for denials specifically. So not just those ones that fall out of the caseload, but what is happening when we see denials? Why is that the case? Is there an equalities aspect to that? Is there a language aspect to that, for example? So that is something that, from where the part of Social Security Scotland that I work in about the analysis and our understanding of our performance. We really would like to understand that. So that is one of our kind of priorities for our further development, is getting access to that data.
Okay, I shall move on. Miriam, if I can go back to the start, because the convener, he always asks the same question, actually, and you should have known that he was going to ask this. The question is, do you accept the recommendations? And your answer appeared to be, we haven't considered them yet, we'll get round to it, and yet this report was published in September, and I would have thought, you knew you were coming here, you'd have had an answer to that very simple question. So why didn't you?
So I think, Mr Simpson, what I did say was that we have gone through the report. We recognise what the Auditor General has said in the report, and we also have a number of other reports that we're looking at, such as the Adult Disability Payment Independent Review, and we will look at all of these reports together. And there's actually some of the work that Auditor General has referenced in here that we are already working on, but we will look at all of these things to decide what the priorities are and give advice to ministers in terms of their decision making to decide what our priorities are for the next phase of social security.
Well, I've got to say, I don't think that's good enough. If you're coming before the Public Audit Committee and you know you're going to be asked that question, the Auditor General tends not to produce a long list of recommendations. He hasn't produced a long list of recommendations. They're pretty straightforward. And you've come here without an answer to that basic question.
I don't think it's without an answer, Mr Simpson. I think for us it is about how you look to implement and phase in the changes that you need to make. I have said I recognise everything that the Auditor General has said within the report. I recognise the recommendations that he has said, and what we now need to do is work on looking at that implementation plan, working with, as I said, with ministers and also at their priorities, and also working with Social Security Scotland to look at how we look at implementing recommendations. So that, for me, is looking at all of the recommendations that we're looking at as well as the Auditor General's. But we do recognise all of the recommendations that the Auditor General has made.
Okay, you recognise them. Well, I'm going to ask you about one of the key messages in the report, which leads to a recommendation, and then I'm going to put the recommendation to you to see if you actually agree with it. So this is around the funding gap, and we've already mentioned that already. So the report, it highlights this funding gap with spending exceeding what we get in block grant by 141 million in 23-24. I think Mr Stevens confirmed that. It's forecast to reach 770 million by 29-30. Implementation costs have so far exceeded initial estimates. And despite this, the government hasn't set out a clear strategy to manage the gap or ensure long-term sustainability. So how are you going to manage that gap? Because you said earlier, you've said repeatedly actually, ADP is fully funded.
Yes, so you're correct, Mr Simpson. I did say that Scottish benefit expenditure is fully funded within the Scottish budget as a result of clear choices by Scottish ministers. And you will note in the report as well that the Auditor General also says that these forecasts are based on the spring statement that was made at a UK level. We did cover forecasts earlier, but I will bring back in my colleagues from Scottish Government around how we are looking at that spend and now what will happen on the back of the decisions that the UK Government have decided not to go ahead with their current reforms. It's also very important that we recognise that within the Scottish budget spend, you will see from all of the budgeting publications that social security is a priority within that spend. So, as I said, it is fully funded, and just like any other aspects of devolved expenditure, it is fully funded and aligned with the Scottish Government's priorities. And that part is, when you look at the block grant they still look at the overall funding in terms of what we will deliver within Scotland. And I'll bring in Kevin and Stephen just to explain a bit further.
Yeah, I think To try and be helpful, Mr Simpson, I think there's a sort of difference in emphasis between the Scottish Government and Audit Scotland. I mean, the Scottish Government publishes its medium-term financial strategy, and that sets out in the document that was published earlier this year that the Scottish Spending Review, which ministers have committed to publishing alongside the budget in January, will set out their strategic approach to public spending over the next few years and the contribution expected from portfolios to achieve that fiscal balance. So the government always looks at these things in the round rather than narrowly looking at how a particular benefit is going to be funded. It's looking at Scotland's public services, and within that, the contribution of social security, and within that, the extra investment that ministers have set out. This year as well, the government has chosen to publish a fiscal sustainability delivery plan. So as well as the strategy, the government sets out its plans to strengthen the public finances, and will be reporting that year on year. And if I may, if I could just come back to your earlier question around recommendations. And again, just to be helpful, if you look at the Audit Scotland report, it talks about the Scottish Government should be reporting annually the plans to manage the differences in benefit expenditure as outlined in the Fiscal Sustainability Delivery Plan. We've actually said in that plan we'll come back every year and talk about those things. And again, with a view to being helpful, the recommendation about reporting annually about the reasons for the differences in costs compared to the forecasts. As we know, and as the Auditor General know, and as the Scottish Fiscal Commission, who are becoming slightly famous in this evidence session, we're mentioning them so often, they're the ones that have the statutory responsibility for producing that very information. So for the Scottish Government to accept a recommendation like that, it has to consider whether it's risking analysing the analysis produced by the Fiscal Commission or whether it's got anything more to add. So that's the reason why I think when looking at the recommendations, there's a slightly different emphasis that the Scottish Government would put in some of these from time to time. Kevin, I don't know if you've got anything to add.
Thanks. I do actually. I've got hopefully a useful point to make on this with respect to the actual numbers here. So, you know, where does the 770 million difference come from? Well, what I was saying earlier on, what I was describing about three different bodies forecasting different things at different times is absolutely relevant to this. So, the 770 comes from the fact that on the expenditure side of the equation, the SFC forecast in May 2025 for ADP in 29/30 was 5040 million. The block grant adjustment for PIP that was produced by the OBR for the spring statement was 4270. Now that difference is indeed 770 in 29/30. However, what we know is that block grant adjustment figure of 4270 includes the projection of the UK welfare reforms that were subsequently reversed, withdrawn by the UK government over the summer. It's therefore reasonable to expect that cut to the BGA would be reversed. And we think the value of that cut was 440 million for 29/30. Therefore, it would be reasonable to add the 440 million cut back on to the block grant adjustment. And if you do that, you get a difference of 330 million, not 770. Now, it's important to say that I am not a forecaster. I am merely doing the maths of the figures that are available in the public domain. I would also like to make reference, Convener, to what the Scottish Fiscal Commission, the famous Scottish Fiscal Commission, said in their fiscal update report of that they published on the 26th of August this year. In paragraph 2.17, quote, therefore, they say, therefore, the savings that the OBR had forecast in March 2025 from the PIP reforms will be reduced, as will the fall in the associated BGAs. We expect the OBR to produce a costing of the updated policy alongside the next UK budget in the autumn. So that's paragraph 2.17 of the report that the SFC published on the 26th of August this year. So I think the 770 figure, absolutely, was the difference between two figures at a point in time, convener. As I've referenced, what the SFC said there in the report in August, that adds a bit of colour. If I may, I could add a bit more colour as well. If we look at now, if I can find the piece of paper, I had all this written down. Yes, so it's also worth noting that if we look at the SFC's December 2024 report, convener, the difference between the BGA and the SFC expenditure forecast for 29-30 was 381 million. It was the difference between the expenditure forecast of 5030 million that the SFC made and the block grant adjustment for PIP, which at that time was 4659. So the difference between those two numbers is 381. So if we assume that the block grant adjustment would be added back, added back when we'll find this out at the end of the month, of course, then the 330 million difference that I mentioned is still less than the 381 million that was the position in December 2024. So there are lots of numbers here because different organisations are producing different numbers at different times, and we have to take a view on that at point in time. So I'm sorry if I've thrown a lot of numbers here at this moment, but I think it's important to demonstrate that there is a lot going on. It is complicated, but I think we can be clear on what the position is. And I think we will find out for sure at the end of this month when we get the updated block grant adjustments from the OBR.
Well, thank you, Mr Stevens. You made a very good go of that. But the upshot is things can change, but there is still a funding gap. Even you, Mr Stevens, seem to accept that with your plethora of figures. I'm not asking you to come back at this point. But there is still a funding gap, and the Auditor General is very clear there's not a detailed strategy from the Scottish Government how it will manage that funding gap, whatever the figure is. So would you accept that?
Mr Simpson, what I would say is that, as we said, we fully fund the Scottish benefit system within the Scottish budget, and also that we do set out in terms of the medium-term financial strategy, and also there will be a spending review that will be published alongside the budget this year, which does talk about how we manage the social security spend and what we look at. And included in that is looking at, as a learning system, thinking about that delivery as the Social Security Scotland Agency were taking about decision making, but also about reviews of cases as well, and having a review of that, ensuring that that is working as efficiently and correctly as it should be. So they are looking at how we look at the spending in terms of across the adult disability.
Okay, but we know that the numbers of people receiving this benefit is going to go up. Adele Harris tells us that. The Scottish Fiscal Commission also predicts the costs will rise quite significantly over the years. So if I can just come back finally on one of the recommendations, and that is the government should set out how the financial gap, because there is one, will be managed over the medium term, including analysis of how this will impact on wider outcomes for disabled people. Do you accept that recommendation?
So what I would say is the medium-term financial strategy does that.
So you accept that recommendation?
Yes.
You do?
Well, the part of we cover that, how we are going to cover the spend. And as I said, that funding and payment of the budget, the Scottish ministers decide how they allocate that budget that they receive, and the benefits are fully funded.
Well, there we are. We've got somewhere. You've accepted a recommendation. Mr Kerr accepted the recommendation that there should be annual reports. That's progress. Thank you, Convener.
Right, thank you very much. We've still got two committee members who've got questions to ask, so I'm going to move straight along to Joe Fitzpatrick and invite Joe to put some questions.
Thanks very much, Convener. I'm wanting to maybe go a little bit back to the start of all this. And obviously Dundee was one of the areas that had ADP first, and the perception of my constituents who'd been in the PIP system was that the purpose of the folk who were doing the assessments was to stop them getting benefit, whether they were entitled to it or not. And they felt, whether it's true or not true, they felt that people had quotas, they felt that, you know, there was a success from the side of the people who were doing the assessments if they stopped someone getting a benefit. Contrary to that, when Social Security Scotland was set up, the aim of this Parliament was that 100% of people who are entitled to these benefits should get these benefits. And that was the aim. Whatever that was the decision of the Parliament. I think it was unanimous. I don't remember anybody saying, no, we need to try and drive this down. We need to stop people who are entitled to adult disability benefit from getting those benefits. It was everyone who's entitled to this benefit should be able to receive it. So Helen, you kind of mentioned that we don't yet have that figure for what percentage of people that should be getting this benefit are getting it. So, I mean, that concerns me because that means that there's a percentage of people who have disabilities that we as a Parliament have decided should be receiving this benefit or not. So, where are we in terms of being able to understand that?
Do you want to go first? Okay. Thank you, Mr. Fitzpatrick. So, yeah, I'll just return to that bit about the benefit take-up measure. I don't think I did actually explain it particularly well earlier. So what we do have at the moment is an understanding more generally of the Scottish population about the prevalence of self-reported disability and ill health and long-term health conditions. So we look at information that's generated by Scotland's census. We look at information that's generated by the Scottish Health Survey. That does give us genuinely helpful context as well. But the reason that doesn't give us an actual benefit take-up percentage or rate, probably more accurately rate, is because those are self-reported rather than being actual assessments of the eligibility for adult disability payments. So someone might absolutely regard themselves as being disabled, but not necessarily that wouldn't match with our criteria, and vice versa. People may regard themselves and that wouldn't match ours. So we don't have that definitive take-up rate. However, and David may want to come in with this, and Stephen may also want to come in with this, there is, as you are aware, a huge amount of work more broadly within Social Security Scotland in terms of the actual design of the services that are delivered that seek to support benefit take-up, and David might want to talk about that. And more broadly, the Scottish Government has a benefit take-up strategy, and Social Security Scotland plays that role in implementing that. So we do a huge amount of work on that, and we also do a lot of analysis of our equalities data as well. So when we're looking at the award rates, for example, we've just published some additional statistics on the equalities as well, and we monitor that very closely because we really do want to make sure that we're doing as best as we can in terms of that benefit take-up ambition.
If I can come in on that, if that's right. So I think just to come back to your question, I mean, absolutely, that's what we see as the role of the organisation. It is, you know, which again feeds back into that take-up point. You know, and I'm enormously proud that the organisation has got that culture that sets off from a position that we are here to help people get what their entitlements are. And you know, there is not a sort of a system, and I won't comment on the UK system, but what I will say is when we were speaking to clients who helped form this system, Stephen's programme did a lot of that early work to sort of understand what was there, and there was degrees of stigma, there was degrees of people feeling that they were unable to go forward onto a system, and actually some people just didn't want to try. So I absolutely take the point around about that. I think you know, and the general sense of which hopefully you're getting, adult disability payment in particular is relatively a new benefit for us. We want to improve the data we collect on it. We want to improve how we use that data, both to drive some of the elements that are drawn out in Audit Scotland's report, but also so that we can start to share at a big data level, for example, with health, which I think have been a point made earlier on. So we make those linkages, how we make that big data linkage with, for example, services and local authorities, using that to drive improvement. And we're also really keen to make sure that we get that data so we can share at a citizen level in order that we can help you know, people get other entitlements to which they're entitled to as a result of this. And a very real example of that recently was the free school meals entitlement. So where data, not from adult disability payment, but data created as a result of a social security system in Scotland is now helping people getting additional resources which they may not otherwise have been able to get.
Good. So and I guess that's just where I was wanting to go on to, so probably more for Miriam now. So clearly the people who are accessing ADP or not, who should be accessing, are also accessing a number of other benefits and other interventions. But the Auditor General suggests that maybe the system is fragmented and we've not managed to embed ADP within the wider system, so no connection to housing, health and employment. So good to hear how we're doing that. Miriam, you mentioned the Disability Equality Plan, but I don't think that includes ADP within it. So, or does it, if I'm wrong? And if it doesn't, when are we going to bring those things together? Because I know that's... We can't look at all these things in isolation because people don't access just one part of the system they've got around their life. So how are we pulling all that together?
Yes, thank you very much, and thank you for the question and for the acknowledgement of the culture shift that has been happening within the benefit system delivery here within Scotland, and I really recognise that difference in terms of how Social Security Scotland are delivering, and their surveys reflect that in terms of what we're seeing the clients saying that they're receiving. And as I said in my opening statement, 9 out of 10 people recognised that dignity, fairness and respect. Your broader question about how does this fit in, and that part for us about the last number of years has been about establishing a social security system here in Scotland and being able to roll out those benefits on a one-by-one system. Now the phase is about how does that contribute across the wider society within Scotland, and looking at that. And the Disability Equality Plan, adult disability is a part of that journey. So the Disability Equality Plan that was published this year, there's an evidence review of that currently going on at the moment, and that will be published within the next couple of months. They are also looking at the report here today and having that as part of their evidence review when they're looking at that to see how we're utilising adult disability. There has been some funding that has been associated with that delivery plan, which focuses on advice, as you would say, because how do we ensure that we're getting that take-up? So there is the role of Social Security Scotland, but there's also the role of wider advice service within that. There's also support within that funding as well for health and social care, for example, and that broader funding to really get that support out to the clients to make sure that they are getting what they are entitled to. Also part of the vision within the Disability Equality Plan is that broader point, which is really important around when policy has been made within the Scottish Government, it needs to put disabled people at the centre of that policy decision making, and having that long-term vision then that allows the disability to be an equality within Scotland, equally within Scotland.
Okay, thank you. I think I'll leave it there.
Okay, thank you very much, Joe. I'm now going to invite the Deputy Convener to put a final set of questions to you. Jamie.
Thank you, Convener. Good morning. I've listened with interest to the session already, but I do have some questions which cover some areas that have already been covered and some new areas. And I think in the interest of time, perhaps whoever is best suited to answer the question, maybe one person answers the question, then I'll get through more areas that would be helpful, please. My first question is perhaps just a wider one about ADP in general and the role it plays in the health of the nation. As we know, Scotland unfortunately has the lowest life expectancy and the lowest healthy life expectancy of all UK nations, and is below the UK average by some 2 years. That's been the case for many years now. In what way will ADP fix that?
So in terms of that broader outcomes, in terms of how we're delivering adult disability payment, it is about enabling people to live the lives that they need to live, and around giving them the additional financial support to be able to do that. And that might be within work, or that might be within their kind of social side of their lives as well, or their daily living, and thinking about just basics of how they're doing that. And for us, there is that part of having to look at the next phase of social security, which is really looking at what are the outcomes that are being achieved by having the adult disability system within Scotland. Because as I said earlier, Deputy Convener, this has been about setting up the system now. The next bit needs to be linking what the outcomes are for people that are receiving that money.
Good. I'm going to come on to outcomes later. I think that's an interesting area we haven't covered. But I want to go over some ground that has already been covered around the sustainability and the finances of it. I think it's important. We're the Public Audit Committee after all. But I mean, the bottom line is we've heard a lot of numbers, and it is very difficult actually to forecast how much these benefits will cost, how much the block grant adjustment will cover all or some of that. and indeed what sort of take-up levels you will get in real time as time progresses and things stabilise. So I think there's a lot of known unknowns there. However, the bottom line I think we all agree on is that the Scottish Government is spending more on social security than it receives to do so. And I think that's a given, you know, and that's forecast only to increase no matter who you ask. That number is going up. So I think there is a valid question, not to criticise the nature of the devolution of the benefit system, but at the end of the day, because it is so-called fully funded by the Scottish budget, the money has to come from somewhere. So I guess my question to the Scottish Government is, how on earth is the Scottish Government supposed to make ends meet and balance the budget when these benefits, as Mr Beattie pointed out, are increasing in cost exponentially over the next 5 years, according to all forecasts?
So I will give a very quick response and then see if Stephen wants to add, and I will avoid figures for ease of that as well. But I think what is key is what you've just said there, Deputy Convener, which is the Scottish ministers make that decision around that priorities of what they are funding, and they are funding the social security system in full around that delivery of our social security benefits. They will look as part of any budget decisions in terms of what those decisions are as priorities. We will offer that independent advice around decisions that can be taken within the system, but also they will look at across their whole government spend to see, and they have committed to saying that the priority is to fund that social security system. Again, just to reinforce that some of the figures that have been talked about today, as we say, they may never actually transpire, because they were forecasts that were looking at a very different system of things changing, which is now not happening. We, of course, as well, we've talked about the Adele Harris report. We will make changes here in Scotland that ministers will make decisions on, just like they will make decisions on this report. That will have to be financially impacted. They will have to be understood as to what the cost is to implement them and what they will need to mean to the spend on the budgets. And the ministers will also need to make decisions about how much it will cost operationally run those and look at that as well.
Okay.
I hope that helps, Deputy Convener.
That is very helpful. And I think it was earlier in the session somebody said that there is a school of thought that if you spend more on social security and stop seeing this solely through the prism of as a cost, but actually down the line there may be savings to be had in other areas of public policy. Now, that's an interesting philosophy, and I hope it's true. But if that was the case, then we would also expect to see, for example, the primary care budget reduce in costs because people are getting healthier, the system is getting more people back into work, tax intakes is going up, and so on. But we're not seeing that. So what we are seeing is essentially is a system where the cost of delivering devolved social security is going up, and the cost of delivering primary health care is going up, and the cost of other social care policies are rising as well. So they're all rising. Whereas, I was under the impression that if we make difficult decisions to spend more compared to other UK benefits, then we get better outcomes. But we're seeing neither better outcomes nor reduced costs in other areas of public policy.
I think it's too early yet to say what outcomes you are seeing, because, as we said, it's only been a short period of time that we've had responsibility fully here in Scotland for adult disability payment, and to be able to understand the complete outcomes and impacts. And I think as well, when Adele Harris was here, she also aired a voice of caution around you really we can't be asking people, what do you spend your money on, in terms of what that is doing. So I think there's also a balance to strike in terms of how we look at those outcomes. But it is for us about how we are working across government with increasing more people into employment from a disabled background, and actually that is helped by the adult disability, and that has helped with the disability equality plan as well.
Can I ask about that then? Because outcomes is important. I'm really interested in this idea of part of the long-term sustainability, which is a valid thing that this committee will look at for years to come, I suspect. But if you're saying that ADP makes people's lives better and healthier, in what way?
So, as
evidence-based. I mean, we have to be driven by evidence.
Okay,
and data on this.
And I will bring in Helen, because Helen, as the analyst, is better within the stats side of that. But what I would say is, remember the intention of what adult disability benefit is here to deliver, and it is that part about helping disabled people living life to a full, to be able to do the task that lots of us take for granted in terms of what they're doing. And we talked about that in the opening statement about, for some people, that is even being able to create their meals in their home, being able to get out to work, being able to do things. So that is what that adult disability is supplementing and helping people to be able to do. But I will bring in Helen.
Thank you. So, Deputy Convener, you might recall in the Audit Scotland report itself, it makes reference to the Family Resources Survey and saying that DWP utilises that to get into some of those outcomes that you're referring to, particularly in relation to things like employability and so on. So I just wondered if that would be helpful to give you a bit of an update on that. So Social Security Scotland does already share its data with DWP as part through our Customer Information Service. And we've also given permission to DWP to use this information to feed into their statistical products, which include it's known as the RAPID database. So it's the Registration and Population Interaction Database. And that database is used to do the data linkage into the Family Resource Survey. So what we can do is, we don't have access, Social Security Scotland doesn't yet have access to that to undertake our own analysis. But what we're hoping to see is DWP are planning to include the Social Security Scotland devolved benefits as part of that resources survey, the data linkage involved in that next year. And that should start to give us, again, some more insight into those outcomes that we are really genuinely interested in understanding what is the contribution. I know you want to speak to one person, but probably if that's the case, speak for Stephen just in relation to evaluation. So the Scottish Government runs an evaluation strategy on the devolution of the Social Security benefits, and what we're looking at is the kind of new, refreshed updating of that strategy, and that is exactly the type of thing that we are looking to gather that information on. We recognise it's early days. Evaluations to date have typically been much more process orientated. So is the benefit working in the way that we anticipated it was going to work, for example? Our clients experiencing what we anticipated, but you absolutely recognise the desire to have that much broader information about what are the outcomes more broadly for our clients, for society, for Scotland.
Yeah, and so let's do that then. And I guess before you answer, the reason I'm asking is essentially it makes complete sense that if you give someone more money, then day-to-day living becomes easier because they physically have more money in the bank to spend on things, pay bills, food, all the things that people need. However, what I think is really unclear is that link between if you create a specific benefit, which is designed to help disabled people, in what way is that helping the recipient? Because at the minute it's simply, as you say, you rightly are not asking what people do with that money. It just simply lands in their bank every month. So how do you then make that difficult task of working out that big chunk of cash, and it is a huge chunk of money, is actually improving outcomes for people in the real world?
I mean, I think as Helen said, we're right in the middle of having those sorts of conversations. The second evaluation strategy that we published, what we're trying to do, Deputy Convener, is to understand is the policy that we've established actually being implemented on the ground and happening. So if you look at the evaluation work that we've published on the transition from child disability payment to adult disability payment, case transfer, child winter heating allowance, we've got reports coming soon on decision-making policy and the special rules for terminal illness. So when you've got that bedrock of understanding, then you can use that as a platform to start asking and looking at the issues that you've been talking about as well, which is the, if you like, the more longitudinal impact of the amount of benefit expenditure and the broader outcomes that that's achieving. We'll need a framework to decide how we're going to do that and consider how we present that information to the Parliament in successive years to come.
Okay. Is there a risk, though, that what effectively has happened is that you've created a benefit which simply can never be reduced or taken away because it's politically impossible to do so, as many governments of many colours have learned over the years. When you make difficult decisions to try and reduce the bill, which in our case is growing year on year and projected to rise probably for the next 5 to 10 years, that no one could ever do anything about it. Once you've put that money in someone's pocket, it's very difficult to take it away from them. And indeed, off the back of the independent review, which is suggesting expansion of the eligibility criteria, even more people will be coming into the system, it's created this huge beast that was just going to grow and grow and grow. Now, I'm not saying that's a bad thing, but it has to be paid for.
So if I could just come back in on that, Deputy Convener, that is why the Adele Harris review was commissioned as part of looking at how adult disability is working here within Scotland. And while I hear everything that you're saying within that, I think for us as officials here, what we do is we will provide advice and look at how we can make improvements within our policies, within each of those benefits, including adult disability, and we will make those recommendations to our ministers. And then, as you know, when we're making those regulatory changes or looking at that, it will come to committee for that decision making and looking at that. So while we go through that process of change, there is the opportunities to make changes within eligibility criteria or looking at different elements of the application form or information you're gathering and looking at that. So there is that opportunity to do that. It is then in terms of getting those recommendations through and into regulations.
Okay, I'll cover off two final quick areas. One is fraud.
Okay.
Obviously, DWP had been around for a very long time. There is a substantial amount of fraud in the system. We all know that. And I'm sure they try their best to deal with it. Obviously, Social Security Scotland is a new entity. It's fully funded by the Scottish taxpayer. Therefore, there's an expectation on Social Security Scotland to take the issue seriously. What evidence do we have at this early stage, and I appreciate it's early stages, of any fraudulent activity within devolved benefits, and what has been done both to tackle it, deal with it and prevent it?
Yes, so in the interest of time, I will let David come in, the agency.
Thank you, Miriam. So absolutely, and this is an area where I would recognise and agree with the recommendations that are coming through Audit Scotland's report around about fraud. Just to be really clear, where the Audit Scotland report talks about fraud and not yet having the tools around about that, that is exactly as you say, Mr Green, in terms of the estimation of it. What we are doing, and we are doing now, and we have been doing since the advent of the agency, is putting those counter-fraud measures in place. So we have a sophisticated counter-fraud team. We have the ability to report directly to the Crown Office and Procurator Fiscal Service where we see fraud. Those checks that we spoke about earlier are one of the mechanisms of which we can identify applications which we may suspect of fraud. So we have the mechanisms in place to counter, to detect, to report and counter, and we have had successful prosecutions for fraud for our benefits. I should also just say, because I know there's been some debate about what may feel like a relatively low level of those prosecutions, we do not, as an organisation, deliberately from legislation that comes from Parliament, decide whether somebody is a fraudster, to use that language, or not. What we do is we report through the system, and only when a conviction has come through from the criminal system would we say that that is a fraudulent application. However, what we do is we will always identify where we feel there may be an overpayment. We can take a new decision on those applications, and we will always seek to recover where we feel there's an overpayment in place. But we have full surveillance powers, which again have come through the Parliament in order to ensure that both we have those powers and are using those powers correctly. We have drawn in expertise from areas you would anticipate, including sort of DWP, HMRC, Police Scotland and various bodies which have got an expertise around about this. So we would robustly look at any applications which we feel are fraudulent using intelligence that we've got. So I just want to make sure there's a differentiation between what's correctly highlighted in the report, saying we don't have the tools to estimate that, which is the start of your point, versus we're not doing anything about it. And that priority of trying to ensure that we do have the tools to estimate fraud is really important, because it is your opening point. There will be fraud in the system. There will always be fraud in the system.
Yeah, there will be. But I mean, let's be honest, Social Security Scotland is hugely expensive to set up. And I would have thought that the tools required to identify fraudulent activity would have been at the core of the start-up costs of the operation in the first place. So it's disappointing to read an Audit Scotland report to find out, or for it to identify that those tools aren't there. And before you come back in, my final question is about operational costs. What are you doing to keep them down? I mean, the cost of delivering the system, not before you even put a penny into someone's bank, is hundreds of millions of pounds per year. That obviously is of concern to the Public Audit Committee.
So on those, quickly on those 2 points, so again, I would say the tools that are being referred to are the tools to estimate, not the tools to identify, to prosecute, and to say absolutely robustly we would do that now, and we have been doing that since the advent of the agency. So I would draw that distinction between the tools to estimate fraud, which I won't, for inches of time, bring Helen in, but effectively a statistical methodology to estimate fraud in a caseload versus the tools to detect, to counter, to prosecute, and to do so. And I say we have been through that entire life cycle of a case now for benefits and have had successful prosecutions as a result of that activity. Just very briefly, if time allows, on operational costs. I mean, I think it was touched at the very start with Helen when she came in on here. Way back to the financial memorandum that accompanied the Social Security Bill, a lot of work was done by the Scottish Government to sort of estimate the cost of delivering the benefits that were already in the sort of the UK system. And we relied on a figure which was 6.3% of the admin costs represent in the existing system of administering benefits. So we would, again, as the report highlights, like to do much more of breaking down our individual costs within the organisation. We absolutely want to do that. But we have always monitored, therefore, against that 6.3%. So I think the latest published figures are saying that we're just under 5% of our admin costs. So the admin costs of delivering the social security system is lower than that 6.3 that had been set out in the financial memorandum. Okay. And it is important. It was not a target. It was not a competition. It was the attempt to say this is what a reasonable, proportionate administration system looks like. So we are operating at a level that is below what we set out to say is a reasonable, proportionate system of delivering social security.
Okay, thank you, Convener.
Thank you. And just two very quick final questions from me. My first one to Mr Wallace, and it relates to the answer that you've just given. It's a hallmark of Social Security Scotland that the private sector is not involved in the assessment process, which distinguishes it from the path the DWP has gone down. Are the private sector involved at all in the surveillance strategy that you just spoke of?
I'm going to say no, in the sense which I think if you're getting us, do we?
Well, you mentioned Police Scotland and the HMRC and so on, public sector agencies of good standing. There's been an issue with HMRC using private companies to debt collect and things like that. I'm just wondering whether you've gone down.
Sorry, I was being too specific and wondering whether we might use a software that had been developed in the private sector, but absolutely not in terms of what you're describing.
Fine.
So again, those counter-fraud teams are employees in the organisation. They may use some tools potentially, but they are ours. We do not conduct any surveillance, outsourced in that sense.
Thank you. And my final question is to you, Director General. And Sir Stephen Tim's review has been mentioned a few times. My question is, are you informally or formally a part of that review?
So I will bring in Stephen as well as Director for Social Security, but for us we are aware of the review, and at an official level we have had some conversations about understanding the scope of that review, and we are aware, for example, that I've spoken with Adele Harris, and it's at ministerial level as well to have a conversation. But in the interest of time, to keep to that, is there anything you want to add to that, Stephen?
Nothing really. I mean, we'll keep an informal link with the team in DWP as the review progresses over the course of this year.
Yes, it's informal rather than formal.
Fine. No, that's helpful. I mean, because again, as Adele Harris pointed out to us last week, there is quite a high level of interdependency between the two systems, both in terms of passporting to benefits, the fiscal framework and how that works, as well as the Barnett formula. So these are all, and Mr Stevens earlier on was able to give us chapter and verse in why that figure may be less, because the planned reductions in PIP eligibility were paused. I think you said reversed. I think they were paused, halted anyway. So these things are quite important for us to understand that there is at least an attempt at ministerial and possibly at official level to have some influence on that review.
Yeah, and in that connection you've just mentioned, Convener, around passporting into universal credit and how the assessment process that we have for adult disability payment and how the work capability assessment works at the moment, but may change in the future and be removed, is really important. So informal is in the sense of there is not a definite link between the work of the review and the work of the Scottish Government, but the implications of the work could be really important for our benefit system, so that's why it's important we keep across it.
Yeah, absolutely. OK, well, look, on that note, can I draw this morning's session to a close and thank you very much. Can I thank you, Helen Fogarty and David Wallace from Social Security Scotland, Stephen Kerr, Kevin Stevens from the Scottish Government, and Director General, thanks to you as well for giving us the full answers that we've been looking for on a range of questions. We will consider what next steps we might want to take as a committee, and we will inform you of that in due course. But again, can I thank you very much? And because we are going to change over witnesses, I'm going to suspend this session of the committee for 5 minutes. Thank you. Well, can I welcome everyone back to agenda item 3 of this morning's Public Audit Committee, and that is consideration of the Auditor General's report briefing into Scotland's Colleges 2025. I'm very pleased that we're joined this morning by the Auditor General, Stephen Boyle. Good morning, Auditor General. And along with Mr Boyle is Derek Hoy, who is a Senior Manager at Audit Scotland, and Ray Bust, who's an Audit Manager at Audit Scotland, who both worked on the report, I think. So we've got some questions to put to you. Before we get to those questions, Auditor General, could I invite you to make an opening statement?
Well, many thanks indeed, Convener, and good morning to the committee. I'm very pleased to present my briefing paper on Scotland's colleges. As the committee knows, Scotland's colleges play a vital role, delivering academic and vocational courses that provide pathways to employment, further studies and apprenticeships. Colleges can be an important stepping stone also to university, support the widening access agenda and play an important role in sustaining the country's sustainable economic growth. In recent years, our reporting on the college sector has highlighted risks to its financial sustainability, and this report highlights deepening financial challenges across the sector, reflecting sustained funding pressures, together with escalating operational costs. This is due to what we've seen as a 20% real terms reduction in funding over the past 5 years, inflationary pressures, rising staff costs, and increasing costs to maintain the college estate. In 2023-24, colleges collectively reported a small surplus of £400,000, and that's an improvement on the £14.5 million deficit that colleges reported in the previous year. Colleges are primarily achieving savings through voluntary severance schemes to reduce their staff costs. This resulted in a reduction of around 8% of the college workforce in 2023-24. 7 of Scotland's colleges reported a deficit in 2023-24, and further deficits are anticipated in 2024-25. The Scottish Funding Council's September 2025 report, Financial Sustainability of Colleges in Scotland 2022-23 to 27-28, that projects a £10.7 million deficit in 2024-25 across the sector. Colleges delivered less teaching to fewer students in 23-24. The number of credits delivered by colleges was almost 10% lower than the previous year, with over 30,000 fewer students attending college during the year. Despite these challenges, though, colleges continue to perform well with their students. Satisfaction rates remain high at 92%. And the proportion of college learners entering a positive destination rose in 22-23, which is the last year that data is available, to 86.7%. Colleges also have strong links with employers in their communities that enable them to align their curricula to local skills needs. But the current level of modern apprenticeship funding does not meet current demand. Colleges now will need to continue to adapt to meet the changing needs of employers and students, and they must tailor how they operate in line with the Scottish Government's public service reform strategy so that they can remain both financially sustainable and continue to play their role in the post-school skills and education environment. Our report contains recommendations to the Scottish Government, the Scottish Funding Council and to Scotland's colleges. And as ever, Convener, between Ray, Derek and myself, we'll do our utmost to answer the committee's questions this morning. Thank you.
Thank you very much indeed for that introduction to the report. I'm going to turn straight away to the Deputy Convener, Jamie Green, who's got some questions to put to you. Jamie.
Thank you, Convener, and good morning, Auditor General and guests. I have to say that's one of the grimmest opening statements I've heard from you since I joined this committee. It's of grave concern, the perilous state of Scotland's college sector, and I think all the statistics you've just reamed off are a testament to that, and can I thank you for the work that you're doing in this sector and space and identifying some of these issues and bringing them to the public fore. I think it's important work for Audit Scotland. I guess my overarching question is, in your view, what is the current state of the college sector in Scotland, and what does the future of it look like in its current form?
So there's a number of facets to that. I think if primarily focus first of all on the financial position. And the financial position is really challenged. So there are some pointers to that I'm kind of happy to start on, and I'll bring colleagues into a bit more detail on that. We refer just to paragraph 16, 17 and go on to set out some of the specifics of some of the challenges that individual colleges are facing. So in 23-24, colleges received what's now known as liquidity support or loans or funding support from the Scottish Funding Council to support their financial balance. On top of that, paragraph 14 makes reference to, again, I referred to my opening statement, some of the analysis the Scottish Funding Council has done that 8 in 10 of Scotland's colleges will be forecasting deficits by 27-28, on top of sustained financial settlements, which have allowed us to arrive at the figure we report with the detail behind that Exhibit 2 in the paper, of 20% reduction in real terms reduction in their funding environments. So there's undoubted pressure within the sector, and we've seen examples through the audit work that's been undertaken across the sector of Scotland's colleges are responding to that. They are absolutely taking the difficult decisions that they are required to do to sustain financial balance, to continue to deliver learning and teaching to their students, support for businesses in their communities. How much longer they can continue to do so is perhaps an unknown, because as ever with a sustained period of financial pressure, it becomes harder to make the savings year in, year out. So there is real challenge, and perhaps to pause for a moment is we seek to make recommendations in today's report about the position that Scotland's colleges will, as part of that wider public service reform. So there is aspects around that, around the use of the estate, which some colleges are already having to make really difficult considerations present about their estate. But where do they fit into the wider scheme of supporting learning and teaching, the various pathways, employment and economic development? But I think it's a moment, Deputy Convener, of decision and of the sustainability of the sector and what then their role is. I think it is, just the last thing I would say is also to emphasise they are doing so. So you can see that that if there's evidence of the pathways that they are achieving, together with some of the satisfaction rates, and that's commendable for with the challenges that they're facing. It's whether that can be sustained if the financial pressures that they're facing continues into the medium term.
Okay, thank you for that. You talked there about a 20% real terms reduction in funding over the last 5 years, and the effect that that's having on what colleges do. I think you mentioned some statistics there. 30,000 fewer students. Staff numbers down 8%, voluntary redundancies, which some warned could become compulsory redundancies, reduction of physical estate. And I think the phrase that struck me most is that there's less teaching to fewer students, was the line that you used. Less teaching to fewer students. So more fundamentally, how on earth can the college sector help the Scottish Government meet its main objectives of governance, of improving the economy, improving the health and well-being of society and getting people into the workplace, scaling up young people? How on earth can the college sector do that whilst it's teaching fewer people less subjects? The two don't add up, in my view, and I get the impression that you agree in your report.
So I think what we're setting out is really the challenge that exists currently, and ultimately this will be a decision that the Scottish Funding Council, government and colleges will set out about how they want the vital role that Scotland's colleges play to be discharged into the medium term. We sought to, and I've mentioned that in my opening statement, is the role that sets out for college as part of that longer term strategy, where do they fit into public service reform? You know, this committee has considered many times about the sustainability of public services. I've commented in recent reports also about some of the developments that have taken place in more recent months about public service reform strategy, medium-term financial planning. We have a spending review coming up together with budget. And these will be the opportunities for Parliament and ministers to set out their intentions. But I think what we sought to do in today's briefing, Deputy Convener, is to illustrate the scale of the challenge that the sector is grappling with to continue to deliver the vital services that they are providing.
Okay, let's look at the reality then of the finances of the college sector. You said that 8 out of 10 are forecast to report a deficit. Can you remind me when that may take place? And what effectively happens when a college reports a deficit? How are they able, for example, to sign off accounts? Or what governance issues would they face when you're in that position? Because, you know, if that was a business, it would be unsustainable. It would close down. Is there actually a risk that some colleges could close?
So there's a range of factors, and I'll certainly bring colleagues in to say a bit more about some of the specifics of how it operates. But in terms of the 8 and 10, so that's with reference to the Scottish Funding Council's financial sustainability in colleges in Scotland. And that's a forecast that they've, with evidence gathering that their role as the funder and oversight organisation of Scotland's colleges, drawing together that material. And that was published in September of this year. So, so up to date, drawing on kind of relevant sources. And 8 and 10 are forecast to be in financial deficit by 27-28. In terms of what then happens if a college enters financial deficit. So again, we go on to say a bit more detail about this, some of the specifics, paragraphs 16 and 17 of the report. So the Funding Council now operates what's known as an outcomes framework and assurance model that sets out the support, interventions, oversight, expectations really of when a college is experiencing financial challenge. Responsibility ultimately still resides with the Board of Management of the college to deliver financial balance and deliver upon the objectives that they have agreed in terms of the outcomes agreement between individual college and the Funding Council. But what we are seeing, as I mentioned, is that in spite of all the engagement, is that sometimes that's not sufficient in and of itself to support sustainability, with some colleges now needing liquidity support to continue to deliver their operations. So we make example in the report of UHI Murray receiving financial support, New College Lanarkshire, and actually also a college the committee is more recently familiar with, UHI North West and Highlands, also received financial support. For completeness, Convener, the details of UHI North West and Highland weren't summarised in this report because of the timing of the completion of the audit, I think for circumstances that the committee is familiar with. So there are now live examples, Deputy Convener, of liquidity support being provided. But what we haven't yet seen is, from the SFC, is setting out and then what happens next, in terms of repayment arrangements, as takes place in other parts of the public sector where there's loans provided to public bodies. Sometimes that's accompanied by either you're required when your financial position improves to repay that. So there's a somewhat new territory, I think I would observe, that colleges are entering into in terms of the support that they are being provided. And maybe bring Ray in actually just to kind of set out a bit more detail perhaps of some of the role of the Funding Council and that, if we can do that briefly.
Yeah, thanks, Auditor General. So we say at paragraph 27 that the SFC requires colleges to set a balanced budget, and that stems, I think, from the governance arrangements. So the SFC's financial memorandum with the college sector has a governance section which it requires college boards to ensure that the colleges plan and manage its activities to remain sustainable and financially viable. So clearly being able to achieve a balanced budget is a core fundamental part of demonstrating the ability to remain sustainable and financially viable. As Auditor General says, the Outcomes Framework and Assurance Model is a new model that the SFC implemented from 24-25, so it's early days. It's been its first year of implementation. What that does is it sets out a number of tools that the SFC has at its disposal that it can use to intervene where there are colleges that are struggling to achieve financial balance. And they cover both funding powers and regulatory interventions that it can make as well. So in terms of the funding powers, we've seen the SFC have powers to limit also they can recover funds from colleges if they aren't achieving their outcomes in terms of credit delivery, but they can also provide those cash advances and liquidity support that the Auditor General was talking about. In addition to that, they can implement additional restrictions or conditions of grant funding to a college. And on the regulatory side, what we've seen in particular with the colleges that we refer to in the report, UHI Murray and New College Lanarkshire, is that where there is liquidity support required, the SFC then requests for an action plan or recovery plan to be presented, and that happened in both of those cases. They've also got other options that are open to them, so that can include just increased level of engagement with the college. They can also undertake investigations, and they can also be more heavily involved in terms of asking for additional information or data from the college, and can also be more present on college board meetings and committee meetings as well to have a closer sight of the challenge.
Oh, that's really helpful, and I think that's useful backdrop to what might happen if a college is in that situation. I guess I'm looking at it from a more fundamental, bigger picture point of view, in that, you know, not just Audit Scotland but other forecasters are looking at the finances of specific colleges, and there's extreme concern that some of them will be financially unsustainable without either more drastic cuts to expenditure, which presumably means job losses, fewer students, courses cut, or financial intervention, either by liquidity through grants, loans, or other mechanisms from government. In other words, an injection of cash just to balance the books on a year-by-year basis. That doesn't sound to me like a long-term sustainable plan for the college sector, though. That sounds like year on year they're fighting to balance the books, and 8 out of 10 will not be able to do so. And according to some of the unions that we've received communication from and Colleges Scotland themselves, there is in one of the models which they've presented to us, a serious risk of closure of some colleges. Actual, shut the doors, we're done. Is that a risk?
So I think all the discussion that we've had so far, together with the evidence that you reference, suggests that there are significant risks collectively to the sector, together with more acute risks. I think what I'd perhaps say is that the analysis that you had before this morning from us is something of a snapshot, and it predates perhaps some of the more acute circumstances that some colleges are currently finding themselves in. So because audit, more typically than not, a retrospective function, it won't necessarily have the up-to-date cash flow pressures that I think that you are alluding to, but I've no reason to doubt that there is a acute pressure within the sector. What I maybe don't have, and I think it's probably more a role for the Scottish Funding Council as part of its funding and regulatory approach, but I don't think there's a divergence between either ourselves, the Funding Council, or indeed the narrative that's coming from individual colleges and their representatives of the scale of the challenge that is apparent.
Okay, and my final question is, you made a number of recommendations. What would be your principal or most important recommendation in terms of how we get this sector back on its feet? Because this isn't a new problem, and I sat in the Education Committee 5 years ago, and the college sector was crying out for cash and warning of job cuts and course cuts and fewer students and the negative outcome that has on society and the Scottish economy. And that was 5 years ago, and here we are today, and the proof's in the pudding in your report today, I'm afraid. So something has to give. The College of Scotland call it a fork in the road. So of the recommendations that you've made, what would you consider the Scottish Government focus on first?
I think matter, if I can say it in those terms. And what our recommendations are designed to do is to support, the challenges of the sector is facing right now. And I don't mean to oversimplify, because you cannot. It's all well and good to say that you come up with a long-term funding and public service reform strategy, so that is there. But also we would say that some of the immediate challenges around staffing the estates matter, and these will be more of the help to deliver the path to some of the longer-term sustainability issues that are set out in the report. As ever, I'm sure that should the committee decide to take evidence on a report, something that you can choose to explore directly with the organisations that we make recommendations to. But we think that these all matter, Deputy Convener.
Okay, thank you for that. Thanks, Convener.
Okay, thank you very much. I'm going to turn now straight away to Joe Fitzpatrick. Joe.
Thanks very much, Convener. In your opening remarks, you mentioned the shift in 2022-23, and it's in the report at page 9 of a deficit of 14.5 million the previous year, moving to 0.4 million surplus in 2023-24. So a shift of 2%. You go on to mention in the report, and I think you mentioned today, that much of that was achieved through voluntary severance. Now, that was a painful process back then, and I think one of the arguments that the colleges that were going through that process was that this was required in order to make their institutions sustainable for the longer term. But it doesn't feel like that's happened. Obviously, the biggest cost with redundancy, if it's voluntary redundancy, is the cost of that package, and there should be savings going on. So I'm trying to understand why what was predicted to be something that would help the college sector become more sustainable, and a lot of pain will have been felt by staff who were at the sharp end of that, doesn't appear to have resulted in a more sustainable system.
Yeah, you're right. I think that I think just in terms of some of the numbers that hopefully are relevant, so there's an 8% reduction in college workforce. I think the analysis from audit reports that the team have looked at, so that's broadly shared between teaching and non-teaching staff in terms of numbers. And you're also quite right, Mr Fitzpatrick, that staffing is the most significant component of college expenditure. About 65% of their total expenditure is broadly in staffing costs. So while headcount has gone down, and I'd agree with you further that going through a voluntary severance, retirement, or in some cases some call it compulsory programme, can be a very difficult process. I think some of the feedback that has come out from individual college and the representatives of that can be quite a traumatic experience, the uncertainty that it can cause for people working in the sector. But in spite of the challenges and pain perhaps that some colleges have gone through, in and of itself, it hasn't delivered the financial balance requirements into longer term. So again, based on the Scottish Fiscal Commission's analysis. And it's maybe just perhaps worth sharing for the committee, I suppose, some of the ongoing financial risks that the voluntary severance programme hasn't helped entirely resolve. So inflationary pressures remain. The college estate is a significant factor that to be addressed. The ongoing financial pay settlement requirements of those that work in the sector. So if the sector is receiving a real terms reduction, people that are working in the sector aren't anticipating a real terms, they themselves dealing with the inflationary pressures. And then the ongoing job evaluation process going back a number of years in the sector has still to be resolved. So Derek might want to say a bit more, or Ray, on just some of the detail of the job evaluation, the voluntary severance arrangements. But despite of the challenges of going through that process, it hasn't in of itself resolved the financial pressures in the sector.
Yeah, maybe pass to Ray for specifics of the job evaluation process, but certainly I think one of the factors that is maybe in play when it comes to not seeing that financial sustainability being achieved through the severance as I think as the Auditor General alluded to, the pay deals that have come through national bargaining, which obviously the colleges don't really have much control over. So I think an element of the savings that would be delivered through the severance packages have been eaten up by the additional costs of new pay deals that have come through. So I think that's been quite a big factor as well. But on the job evaluation, Ray, I don't know if you're happy to say a bit more about that.
Just very briefly, if I may, then I think the point with the job evaluation is that I think that presents a significant financial sustainability risk to colleges in the future. A number of colleges highlight that specific aspect within their accounts, features in the annual audit reports for those colleges as well. And I think it's fair to say that colleges are, to a degree, a little bit nervous. So colleges under the current accounts direction have to account for the provision to meet the liability that will fall as a result of the job evaluation. They currently no longer in their accounts present an asset in terms of the money that's been set aside to meet that liability. That now sits with the Scottish Government as of, I think it was March 2023 that the Scottish Government took on that responsibility. And again, just in terms of complying with accounting requirements, the Scottish Government doesn't currently, in its accounts, set out a liability or money set aside to account for that. So there's an element of nervousness, I think, within colleges in that respect, but also just in terms of not only meeting the back pay element of the job evaluation, but looking forward to what that will mean in terms of the costs, the staff costs that they will have, which we know are around about 65 to 70% of a college's expenses. What will that mean for those in the future as a result of the job evaluation?
8% reduction in staff, and I think the suggestion there is maybe that might have to be higher if some of these other pressures go on. You mentioned at the start that the experience of students is still positive. Is that going to continue, or are there other longer term implications of those staff reductions, particularly reduction, well, all of it, and teaching and non-teaching clearly has an impact on the student experience and the levels of courses availability. Teaching time, you've said, is already going down. What's the long-term implications if this is the route that colleges continue to go?
So I think the first thing is it's noteworthy that satisfaction levels have held up. I think that's it's an important factor in all the context, the volatility that the sector is facing. Whether that's a good indicator of future satisfaction levels, I don't know. I think that you can see that there are some suggestions in terms of the choices that colleges will need to take around the type of courses that they'll provide. What's some analysis we've referred to in the report about the optimal size of classes in terms of whether that will drive particular course offerings and that will inform satisfaction levels. Changes in the estate that might be coming through as well, the availability of support. We come on to say more about this, about some of the additional support that colleges provide, but provision of mental health support for students too, are all, I think, variables that we would identify that, whether they are, can be addressed in a way that doesn't impact upon student satisfaction, the attractiveness of the sector in the round, I think, are unknowns at the moment, but probably without speculating into specifics, I think they are real risk factors that will influence the satisfaction levels into the future.
The report suggests that there's some areas that are already being squeezed. One area that I think you flag is English for speakers of other languages. There's a big push for people to be able to speak English if they live here, and there's high demand for that. People are wanting to make those changes, who've have come here for whatever reason and are wanting to learn English as a second language so they can contribute more fully to our society. How severe is that? Something that there's high demand for, something that clearly helps people become economically supportive to our economy, but if they're not able to access those courses.
Yeah, I think Derry might want to say a bit more about this, but I think it's one of the examples we cite in the report in terms of an oversubscribed course, and I think one of Glasgow College is making a difficult decision, I'm quite sure actually, about its ability to provide that service. So it's indicative of the wider difficult choices that colleges will have to make about their course provision, and sometimes not necessarily based on the demand for a particular course from students, Mr Fitzpatrick. But again, Darren, if you want to say a bit more about that.
Yeah, thanks, Auditor General. I think maybe Mr Fitzpatrick, it's useful to draw your attention to the recommendation that we make to the Scottish Funding Council, that they identify how to measure unmet demand for college courses. So I think at this point in time, we don't really have a clear understanding of where the unmet demand is. So we do have some examples like the ESOL example that you mentioned, but I think it's really important that across the sector there's analysis carried out to understand where those gaps are, especially in relation to the Scottish Government's economic objectives. Are the courses that are being cut the ones that would really deliver against those objectives? I think there's a lack of understanding of exactly where we are with that just now, so I think it's really important that analysis is taken forward to give a better idea of the picture of what's going on, and that would hopefully help to inform decisions on what courses might go in the future.
Do we need to consider a different way of funding those sort of courses, or do you think that it's something that the Scottish Funding Council can wrestle with?
I mean, whether it's those courses or if it's kind of wider commercial offerings, I think is relevant. And we do touch on this in the report, that where we've been, I think some of our reporting to the committee in recent times on individual colleges is where they have sought to diversify into income generation approaches, and some of those examples not being successful. And I won't repeat the examples, but we also recognise that colleges will have to continue with this approach as part of a wider strategy on financial sustainability. But perhaps we're kind of learning from some of the examples where it hasn't been successful to give them more security, certainty about when they're deploying more commercial approaches, whether it's around ESOL or trading or activities with third parties. Is that I think it's inevitable that will become part of the model even more than it is already, but doing so with the right underpinnings really matters.
Okay, thank you.
Thank you very much. I'm going to again move straight along and invite Graham Simpson to put some questions to you. Graham.
Yeah, thanks, Convener. So just following on from what Joe Fitzpatrick was asking about on courses, do we have any analysis of which courses have been cut? So, so far. Now, I'm thinking really in terms of, colleges are so vital, I think, for providing the skills that Scotland needs. So are we at risk of, reducing the impact that colleges can make?
So I'll turn to colleagues actually if they've got more detail in the specifics that might help the committee. I think what we generally tried to do with this paper is provide more of a higher level summation of how the sector's financial position is and performance from one year to the next. So I think if it's helpful, just supposed to repeat some of the change in scale of engagement with the sector. So 30,000 fewer students were taught in 2023-24, that varies to some extent by college to college, and some have increased and some will have decreased. But the point you make is absolutely right, and one I agree with, that the vital role that colleges play in terms of the economic contribution, social mobility, and there again there are some indications around course completion rates that might be helpful just to get into a bit more detail with the committee. So again, I'll pass to colleagues if you want to kind of say a bit more about that.
So just to kind of give you a little bit more of an overview. So colleges we spoke to were quite clear that to this point they have worked hard to protect the courses that they are offering. So I think what we're seeing is rather than courses being completely withdrawn, it's more a case of they might reduce the number of cohorts that they offer the course to. A course that they've previously delivered at 2 or 3 different campuses will now only be offered at a single campus, which again also has impacts for students. So I think it's less a case of us clearly having a picture of specific courses or subjects that are being withdrawn. As I say, it is more a case of colleges looking to try and deliver those courses in a more efficient manner. So, as we mentioned in the report, things like increased class sizes, moving more to online delivery, reduced class times as well. So those are the ways in which they're trying to make it more efficient for them to be able to deliver the same courses. I think rather than saying specific courses are being withdrawn, what we're seeing is more from the side of unmet demand. So, for example, in terms of just pure delivery, West Lothian College, I think they currently deliver for around about 44,000 credits per year. That's their threshold that's agreed with the SFC. They currently estimate that they have demand in their area to deliver in excess of 50,000 credits, had they, and would do so if they had the funding to be able to do so. They expect that to increase as the population in their catchment area increases. For example, Ayrshire College, I think it was an evidence session to the Education, Children, Young People's Young Persons Committee, had talked about turning away over 700 students after interview, so that's not even including those that wouldn't have been offered an interview, and highlight that many of those would have been seeking courses in STEM subjects. And similarly, Glasgow Kelvin had also told us that they have unmet demand in their area for STEM, as well as the ESOL course that we highlight in the report.
Okay, so basically there is a demand, and there aren't places to fill it. So I suppose my point stands, and things could just get worse.
It's an illustrative example of where colleges are having to make difficult choices in terms of the funding, the associated income that they receive, and the funding arrangements through the credit system, which has eased. I think as we set out in the report with the Funding Council, with some more flexibility around learning credit targets. But again, in and of itself, like the steps that they've taken around voluntary redundancy, they're also having to make challenging choices around course provision, managing access to where these are oversubscribed. So again, just one of the many steps that colleges are being faced with the challenges that are in front of them.
Okay. Can I just turn to the submission from Colleges Scotland on the budget, which I'm sure you've seen, and Jamie Green mentioned this earlier. There was a paragraph in here, right at the start actually. It says, the Scottish Funding Council has recently set out the stark reality of the impact of, they're talking about the reduction in funding, of this reduction in funding in a report which concluded, quotes, most colleges are not sustainable, close quotes, under current funding assumptions, and there is, quotes, an imminent risk of some colleges becoming insolvent by the end of 25-26. Do you agree with that?
So I'm not party to the very specific detail with which they've made that assertion. And in order to make an informed decision, I think I'll need to base that on the up-to-date analysis that the external auditors will do of individual colleges. So I mentioned to the Deputy Convener that this is based on 23-24 audited accounts. Taking us up to the date that you just mentioned, Mr Simpson, there'll be a further 2 sets of audits that will take place. And one of the key criteria that auditors will look at is financial sustainability in their analysis. In overall terms, I don't think I have any reason to doubt, and I think it's a continuation of some of the detail of financial challenges that the sector is facing. What I haven't yet been able to triangulate is what that means for individual colleges. But I think as we mentioned already this morning, some of the numbers are really stark in terms of 8 out of 10, together with the financial interventions that colleges are asking from the Funding Council to stay afloat. So I don't think there's any real disagreement in overall terms, but what I don't have is the precise data of who and where of those colleges that are forecasting in 2026 severe financial issues.
Okay. They set out a range of scenarios, and this is for the budget, one of which is flat flat cash. They put that as a decline situation. Then they go to diminish, survivable and sustainable. If you look at the decline situation, which is flat cash, according to them, 11 colleges would be at risk of running out of money. They wouldn't be able to cover operational costs. Those 11 colleges employ around 6,500 staff. And there is a fear that some colleges could close in that scenario. Now, in your report, you mentioned that the two colleges were bailed out. Really, they were given extra money by the government, and they're going to, I presume, they have to pay it back. We've had sessions where we have, we were made party to a kind of risk register that the Scottish Funding Council had, which highlights that some colleges were at risk. Can you see a scenario where colleges could close?
Again, I don't know if it's helpful for me to speculate on that. I think what inevitably would happen beforehand is probably some of the examples you've seen before already, with emergency support, liquidity support coming from the Funding Council that averts that cliff edge scenario that's been referred to. But I think, and that probably illustrates the kind of wider point that colleges are they've already taken some of the very hard decisions that other parts of the public sector haven't. So voluntary severance schemes are not normal and elsewhere in the Scottish public sector, but they have become embedded within Scotland's colleges as a means of managing their financial position. So they're taking the difficult decisions. I think probably going back to some of the earlier discussion we've had this morning, is whether they can continue to do that. And I know that Mr Simpson, you and other members of the committee will be familiar that some of Scotland's colleges are already considering very difficult decisions about individual campus services. And that, again, is an example of an incredibly difficult decision that some colleges are having to take to support their financial position that other parts of the public sector aren't. So short of, if those measures don't work, then you may be in the scenario that you're referring to. But I think together with the Funding Council support that we've examples of, together alongside some of the very hard operational decisions they might take, might avert the closure scenario. But it all speaks to a sector that's under severe pressure.
Yeah. Convener, in the interest of time, I'll leave it there.
OK, thank you very much indeed. I will then, in the interest of time, go straight away to Colin Beattie. Colin.
Thank you, Convener. General, I'd like to have a quick look at the states. Paragraph 31, the chair of the College Principals Group recently told MSPs that the cost to cover backlogs of maintenance and the transformation of the campuses to comply with net zero targets is now estimated to be nearly £1 billion. Paragraph 32 explains that colleges are considering physical and digital estate rationalisation to help achieve savings. Can you provide any more detail on what the colleges are actually considering there by way of physical and digital rationalisation, and what additional challenges are raised in this by their attempt to meet net zero targets?
Yeah, I'll maybe start with a specific example, then bring colleagues in of some of the kind of the broader ways of potentially addressing such a large number, if it is possible, Mr Beattie. I mean, £1 billion is such a significant number in terms of the overall funding position of Scotland's colleges. So, but it's also, I suppose, by contrast and comparison, there are equally large numbers elsewhere in the Scottish public sector in terms of whether it's backlog maintenance. So the ability to address maintenance of the estate is not unique to Scotland's colleges. However, it is a very real challenge. As mentioned, just opposed to some of the specifics around how to manage the estate. I think we mentioned in the report, for example, of the funding that individual colleges receive relative to their maintenance requirements is not keeping pace. So for example, City of Glasgow College is cited in the report of needing many times more investment in its estate that it receives as part of its share of the capital maintenance funding from the Funding Council, and that's replicated with other colleges. At the more acute end of the scale, again, some members of the committee will be familiar with some of the processes that Forth Valley College is currently going through in respect of its Alloa campus. And the most recent position that it's stepped back from some of the decisions to allow for further discussion with the Scottish Funding Council, employees, students around that. But again, it illustrates just how significant some of the decisions that colleges are considering to balance their financial position and looking at their estate, the services they provide in different locations and what that means. So all of that has to go through a really important process before any decision is made. I'll pause at that point, actually, maybe if Derek or Ray wish to say a bit more about some of the maintenance requirements across the sector.
Yeah, I think perhaps I can just ask while you're responding there, it's not just the maintenance of the buildings and so on. I want to understand more also about this digital rationalisation, because I don't quite grasp it all.
I think, Mr Beattie, we're still to see some of the detail of that come through. So colleges are working on their state strategies at the moment and considering state rationalisation. That's been supported by the Funding Council. And encouragingly, from the conversations that we had with the Funding Council, they're supporting colleges to take a forward-looking approach to their estate rationalisation. So not just looking at what they have in place just now and how they maintain that, but what are their estates needs for the future based on it. That will be a difficult thing for them to predict, obviously. But look at the demographic trends, etc. What sort of estates do they need in the years to come? So I think those strategies are currently in the process of being developed just now in the lead up to the SFC publishing its infrastructure investment plan hopefully next year. So I don't really have much in terms of detail unless Ray, there's anything that Ray wants to add into there. But I think the encouraging thing from us that there is, from the SFC point of view, it's about taking a forward-looking approach to that, planning for the future, not just thinking about the here and now and trying to prop up what's already in place. Ray, I don't know if there's anything more on specifics on digital rationalisation that you would like
So
to
I think on that, so in terms of that paragraph 32, I think fundamentally, first of all, I think we can't talk about specific colleges in terms of the scope of our overview, but I think in simple terms, primarily we're talking about selling land, buildings or campuses in first and foremost. In terms of digital rationalisation, so I think we're talking, and perhaps use City of Glasgow College as an example there. So City of Glasgow have talked about the funding that they require as part of their capital grant to upgrade their digital network. I think they required something in the order of £2 million per year. I can't remember the details in the report here, but the funding that they have doesn't meet that. So that would be an example of the kind of digital sort of transformation that they're proposing.
So digital rationalisation would actually be a relatively small figure compared to the £1 billion.
Yes, a component of it. I think that, and also I think Ray mentioned earlier, and we'd also get a bit more detail at paragraph 36 about the way that colleges are delivering learning is changing. So pre-pandemic, most of that would have been done on a face-to-face basis, but there is still now a digital component, norm for many courses of a hybrid approach to learning and digital and face-to-face mix. We make the point, and again, consistent with the report we brought to the committee last year on digital exclusion, about the need for kind of striking that right balance between the needs of learners and across the sector. But digital rationalisation, managing the sector risks, embracing new technologies are all harder when there's a maintenance backlog that will also be a call on the capital budget that's already constrained.
Okay. In the interest of time, I'll move forward on that. Paragraph 42 of your briefing, just to look at something slightly different, indicates that the Scottish Government is keen that colleges identify additional ways of generating income. Can you provide a bit more information on that? Because I recall in previous years their ability to gain income from external sources in terms of, running courses for businesses and so on, was actually shrinking. And I just wondered where we are now. How are they diversifying into other areas outside of that, or where are they?
So again, I'll turn to colleagues actually and give you a bit of a kind of detail if we have about how some of that's translating into breadth across the sector and any income generation activities. I think, as I mentioned to Mr Fitzpatrick, I think it was, in terms of the broadening of the reach of colleges. You can clearly see the signal from the Scottish Government as it's supportive of this, and also perhaps necessary, but to be managed in a really careful way. So if colleges are going to broaden their reach into commercial activities, that they get that, they do so with the full understanding of the necessary skills, risk, governance to support, so they do that as safely as they can do so. It represents colleges taking on more risk at a time when they are facing significant pressures, and pressures in that environment all have to be managed. So I think, whilst I understand why this will be a necessary step that they'll have to take given the financial pressures, Mr Beattie, it does bring in an additional layer of risk, I think, as we've seen in some of the recent reporting that we've produced on individual colleges where you haven't quite got that balance right.
So where actually are they going to try and identify these sources of funding, external sources of funding?
So I think colleagues might want to come in and say a bit more detail, but effectively, really, it will be from individuals and businesses in their communities. So tailoring their offer to what their communities require in terms of building the pipeline of support and talent that businesses in their areas will want. So there's a commercial component to their work, so they get the right engagement. And as we go on to say in the report, that colleges are starting from a good foundation. So colleges know their communities, they know what businesses need. It's finding a way that they can evolve with changing way of business and industry in the country, and they have those relationships that allow them to benefit financially from that. But Ray might want to come in.
Yeah, just Mr Beaton, on your point there. So I think this is why we make a recommendation to the Tripartite Alignment Group. So the Tripartite Alignment Group, which consists of the Scottish Government, SFC and Colleges Through Colleges Scotland, have a work stream specifically addressing this particular point, exploring opportunities to increase income generation. So I think so that's why we make the recommendation that it's the Tripartite Alignment Group should within the next 6 months set out plans for that. So it's something that we're yet to see, but that would be the vehicle by which we would expect it.
Now, we've seen that some colleges have set up subsidiaries with varying success. Is this within their capability? And I think you touched on that, or General, a little bit. Is it within their capability to manage subsidiaries and this new income-driven aspect to what they're doing? Is that really where their expertise is?
I think that's a step for the boards of management and the funding council to satisfy themselves that they are taking on additional risk and activity, but in a managed way. I wouldn't want to give the impression to the committee that because of the recent examples where we've reported on a small number of colleges that haven't got this right, that's symptomatic of not having the skills within the sector to do so. I don't think that would be a fair conclusion. Look at the breadth of skills and backgrounds that are firstly represented on the Board of Management of Scotland's colleges, along with the background of the executive leaders in colleges, suggest that fundamentally, with the relationships they have with business and other people who are interested in their services, that they have the right platform to do so. But that they get the underpinnings right, that the governance works, risk management, scrutiny and oversight is all appropriate for a different type of model. So they're not managing a college necessarily, especially if they're going into a commercial subsidiary model. It's something for the Board of Management fundamentally to satisfy themselves, but fully in the knowledge this is a new risk for the new activities that the government is supportive of them undertaking.
Putting more effort into this particular area, everybody is now fighting for funds and from the private sector. Is there not a lot of competition there, even between the colleges themselves? I mean, I said before that in the past we've looked at reports where there's actually been shrinking revenue from that source rather than expanding. Isn't this a challenge that they're going to struggle with?
Very important point, actually. You can't necessarily assume that this will be the route to financial balance for Scotland's College. I suspect in and of itself it won't be. So you're right, there will be competition between colleges. Universities will also be operating in this market too. So for colleges to be clear about what their offer is and that their forecasts and assumptions are realistic, I think it would, with real scrutiny for a Board of Management to cast their eye over if forecasts are coming back that an individual commercial activity is going to solve a college's financial problems. I suspect very much that it will be a combination of factors in terms of funding, management of the estate, staffing provision, course content, along with commercial activities that they might undertake.
Okay, let me move on to one final area, really the credits and funding model. Looking at your briefing in paragraph 49 about credit-based funding, which you state is output-driven, and colleges must meet their credit targets to avoid having them recovered by the SFC. Can you explain a bit more detail how this credit system actually works for colleges and their funding?
Yeah, I will bring colleagues in actually just to kind of set this out in a bit of detail. It is complicated, I think, as alluded to earlier. It has changed in recent years in terms of the targets and more flexibility being afforded by the Funding Council to colleges about how many courses they must provide to individual students. But again, thanks, Ray. Ray's going to kind of set that out for the committee.
Yeah, I'll certainly do my best to try and explain it. So I think it's paragraph 52. The first bullet point, we make a point that from 25-26, so the current year, the SFC kind of changed the way the distribution model works. So from this year, each college receives a single core credit price that it gets for each credit of teaching that it delivers. So fundamentally, in terms of the funding allocation, there is an agreement between the college and the SFC in terms of the number of credits that it is expected to deliver, with a specific credit price for each of those credits, which multiplied together comes to a funding allocation for that college. We're not yet at a point where we're saying that this is happening, but what we're doing in the report is recognising a potential risk that I think colleges recognise exists, which is that as they increasingly find it challenging to achieve financial balance, and given that there is this set core credit price that they are allocated for all credits that they deliver, regardless of the course and regardless of the cost to deliver that specific course, the colleges may feel pressured and being pushed a little bit towards delivering more of those courses that are more cost effective to deliver, potentially at the expense of more expensive to deliver but more in demand courses. So in a sense, moving to a position where those courses are effectively subsidising those that are more in demand. So essentially, to give you an example, for a college delivering a course where it requires expensive machinery or equipment to deliver, that can only be delivered to a smaller class size for health and safety reasons, clearly that would become more expensive to deliver a single credit on, compared to others which can be delivered to a larger class size and it doesn't require the expense of those pieces of equipment. So ultimately that leads us to a position where in the current funding model, a college could be achieve credits through more efficiently through the choice of course that it provides.
But isn't it inevitable that lower cost courses will subsidise the higher cost courses? Isn't that an inevitability of the system? Isn't that? Is there a problem with that?
I think it's a possibility, but I think also with the financial pressures is whether or not lower cost courses just become the norm. I think so. The report, for example, building on Ray's example, talks about, for example, additional support for learning courses typically have a far lower number of students within them, and that's an expensive model. So if that is part of the real difficult decisions that some colleges might have to take, actually you go for a larger class sizes as being the norm. That might not necessarily suit the needs of their communities or businesses or the type of courses that they are looking for the college to provide. So I think it's a balancing act that colleges will very much need to strike, but you can see some of the motivations that might be at play given some of the severity of the financial position of some of Scotland's colleges.
Presumably Audit Scotland is going to keep an eye on this and report in the future.
Yeah, very much happy to confirm that to the committee. We'll continue to maintain a strong interest in Scotland's colleges, both through the individual annual audits, together with sector reporting that will feature as part of our work programme that we'll bring back to the committee for consultation.
And just one last question is, can you maybe tell us a bit more about how the SFC's college transformation framework will work in practice?
Yeah, very happy to. I think we set out in a bit of detail the college transformation framework reference to coming in 2025-26. And again, I've talked to some extent already this morning about some of the additional flexibility that with the Funding Council, no doubt recognising the financial pressures that some of Scotland's colleges are facing. So afford flexibility in terms of learning credits, but not the changes in the need for colleges to meet credits without penalty, so that increasing by 10%, and that's significant. Ray might want to say a bit more about some of the overarching aims, but I think it's indicative of the Funding Council, together with colleges, an acknowledgement of some of the pressures that are being faced, the need for more flexibility, and the evolution of the assurance and scrutiny model together with the funding that the Funding Council provides. But I don't know if there's anything you wish to add, Ray?
Yeah, so just very briefly, thanks, Auditor General. In terms of the college transformation framework, as you've just set out, the fundamental point is that it gives colleges a little bit of breathing space, an opportunity to submit a proposal to the SFC. As part of that, that would allow them to reduce the number of credits they deliver by 10% without recovery of the funding that equates to those credits. I think where we are at the moment is, I think the SFC have advised there's a couple of colleges who are going down the road of exploring this with the SFC, have a proposal that is developed. I think there's certainly one other college that is at an earlier stage of that progress, so there is some interest in it. I think the point we do make, however, is that in terms of this flexibility, it is only going to be suitable, or it will certainly be more suitable to those colleges where there is less unmet demand. Where there is already unmet demand, this doesn't necessarily have as much value to those colleges.
Thank you. Thank you, Convener.
Okay, thank you. And before I put my questions, I'd refer members to my voluntary register of trade union interests. Can I ask, if you look at the accounts of the City of Glasgow College, which has cropped up a couple of times, it's carrying cash reserves of £12.3 million, which was up from £10.5 million the financial year before. Why is that? Why is there such a high proportion of cash reserves held by a college in the midst of this financial crisis?
Give you a range of factors, Convener. Without, Polly, I don't have the college's accounts in front of me to see if there's any trends behind that, but if it's coming from the statement of financial position or balance sheet, it's only ever a snapshot of the cash position. So that could potentially change significantly the following month or months thereafter if there's any large invoices that they were due to settle. But cash balances matter, no doubt. I absolutely recognise that point, particularly some of the liquidity issues that the sector is facing. The use and the importance of medium-term financial forecasting is part of how Scotland's colleges do business. So while if there's a specifics of a challenge for that college or more stability, I think from our perspective it doesn't necessarily change the overall analysis that the sector is experiencing challenge, but cash does matter. So happy to look into that further.
Okay, thank you. I mean, if I look at Appendix 3 of the report, you set out a table of what's happening to full-time equivalent posts by college, and the biggest percentage cut in full-time equivalent staff is at the City of Glasgow College. So I just really don't. Incidentally, the second biggest cut, and we'll come on to it, is Forth Valley College of full-time equivalent staff. Do you have any understanding of why, at the same time, a college is sitting on significant cash reserves, it's also reducing its staffing numbers, teaching and non-teaching staff, by such a huge number, 160 odd people within 12 months walking out the door?
Yeah, if in percentage terms, that's probably moderated, I think, given the number of people who work for the college. But I understand the point that you're making, both in terms of City of Glasgow and Forth Valley are taking the scale of challenges in front of them and reflecting that in the voluntary severance arrangements that they're going through. What I don't have, Convener, in front of me is their accounts that would perhaps allow me to answer your questions more fully about what that means for their financial plans into the future. If there are specifics that I would expect that those cash balances are earmarked for particular projects. Normally there would be a correlation between the cash balance and then the amounts that are held to deliver particular activities into the future. If it's helpful, something that, unless colleagues have the detail to hand, we may need to come back to you in writing on those two specifics.
Okay. Do you think the Scottish Funding Council needs more powers, greater sanctions, to stop colleges perhaps getting themselves into financial difficulties? Is that something that would work, do you think?
I think what we've seen is an evolution of the Funding Council's roles and responsibilities, the support that it's been providing the sector in recent years. So the outcomes and assurance framework, for example, is perhaps the most obvious example, where I think the Funding Council is clearly setting out what it will do, the role it will provide, and that's on a spectrum. So from monitoring, support, engagement with colleges, right through to some of the examples we've seen already of providing financial liquidity support. Beyond that, I think it's perhaps a question I need to think more carefully about in terms of whether that should translate into regulatory interventions. But I think we're already seeing the Funding Council acting as both a funder and a regulator much more actively than it would have had to do so in previous times because of the financial pressures that it's facing, the sector's facing.
Yeah. Yeah, and again, the job evaluation of non-teaching staff has come up earlier on this morning, and as indeed it has come up almost every year when we've had these evidence sessions or been looking at particular colleges, because it's a long-standing, outstanding piece of unfinished business. And it's not entirely. My understanding, I think, was that the Scottish Government, you mentioned, I think, money transferring to the colleges, then transferring back to the Scottish Government. My understanding is the position is the Scottish Government has underwritten the outcomes of the job evaluation. Is that your understanding as well?
Yeah, I think, broadly speaking, that the Scottish Government is committed to fund the cost of the job evaluation scheme. And I think, as we reference at paragraph 19 of the report, that has been estimated at over £86 million to date. What I would observe, I think, as we set out in the report, Convener, this is taking quite a long time, 7 years or so into the process. I'm sure it would be helpful for all concerned for this to be resolved as quickly as is possible.
Okay. Sorry, I'm jumping about a little bit this morning, but can I take you to paragraph 35, which speaks about the importance of the community relationship between a college and the community in which it sits. And I can't help thinking about anywhere else but Alloa, where there is a very strong... I mean, there's been a... Clackmannan College was established in the 1960s. It became part of a merged group with a campus in Stirling and the long-standing Falkirk campus. But as you've alluded to already this morning, it's now under threat. But you describe in that paragraph why that community relationship is so important. Do you want to elaborate on that a little bit before I get to another question?
Yeah, perhaps not terribly much more to say. I think really beyond comments we've made in almost all the college overview reports that the Audit Scotland has produced on my behalf about how central colleges are to the communities that they serve, the pathways that they provide to education, training, employment. And inevitably, if there's really difficult decisions that colleges are having to make, and they are, in terms of their campus provision, that they need to do that through careful engagement with their communities. We spent a bit of time, I suppose, just what are the frameworks that Scotland's colleges are required to operate in terms of that engagement, and perhaps maybe reflecting the era that the legislation relates to, convener, is that the Further and Higher Education Scotland Act of 1992, nor the Post-16 Education Act of 2023, they don't directly address Scotland, college closures. We know, again, as we reference in the report, that there is guidance from the Scottish Funding Council on disposal arrangements. But maybe a better reference is the Code of Good Governance for Scotland's colleges and the steps that it sets out that the Board of Management needs to take so that the voice of students is central, the importance of corporate and social responsibility. And that all translates over and above legal expectations about the importance of proper engagement, consultation with students, staff and communities when any of these really difficult processes and decisions are being considered.
Yeah, I mean, and with that in mind, are you... do you have any oversight of the feasibility study, which I think is being established by the college to look at the future feasibility of the Alloa campus? Do you know what its terms of reference are, what its scope is, who's been hired to carry that feasibility study out? I think the Scottish Funding Council are involved in that.
No, I don't have any direct role in that. I think that is a matter between the college and the Funding Council. Where my interest is served is through the work of the appointed auditors, who will be reviewing the college's arrangements, the audit of the financial statements, together with a wider scope annual audit report, which will capture some of the decision-making arrangements that the college takes as it goes through this process. But I think, as you say, convener, I think this is a matter between the college and the Funding Council, together with staff, students and the community.
Okay, thanks. Can I just finish up by going back to a point that was raised earlier on by Colin Beattie, but it's about with these subsidiaries and with these other enterprises which colleges are entering into, do you think there is a proper sense of the risk that's involved? Do you think that the governance structures are fit for purpose to give proper oversight and have accountability to those kind of initiatives?
So I can't give you complete assurance on that point, and that's informed by the fact that 3 recent reports from me statutory reports have referenced where engagement with third parties and commercial activities hadn't gone well enough. So we expect, as I'm sure you do, convener, that where statutory reports are produced on a sector, that they are used by the whole sector. So if any part of any lessons learned, management of risk, But I think it's very clearly that this is additional risk that the sector is going to have to, or is planning rather, to undertake, and the importance that they get that right. Proper oversight, scrutiny, governance, engagement are all key steps that they'll need to take as they're embarking upon these new activities.
Okay, well, thank you very much. That draws this session to a close. I'm sorry we were a bit pushed for time in this evidence session, but can I thank you, Auditor General Derek Hoy and Ray Buse, for the evidence that you've provided with us. We'll obviously need to consider what our next steps are, but again, just for the record, to thank you very much indeed for your evidence this morning. And I'll now move the committee into private session.